on.
Very good.
और क्या हमारा टाइम स्टार्ट हो गया, खाली नहीं हो रहा, लोग नहीं जा रहे।
नहीं, हमारा नहीं है।
I would again like to request all the invitees and attendees who were attending the prior session to kindly vacate the room. We do not have space for our invitees.
Sure. Ladies and gentlemen, can I have your attention? The next session will start in 5 minutes. Who all have not registered for the session can join the respective sessions. Thank you.
Everybody, I'll again request those who had been attending the prior session to kindly vacate. We do not have space for our invitees to sit. We request cooperation from all of you. We are about to begin our next session. Our panelists are already here. I would request those who had been attending the prior session to kindly please vacate for our invitees and guests.
शॉर्ट हो गया ना इतना पैनिक क्यों कर रहा है तू डरा दे रहा है आपने स्टार्ट कर दिया ना वो
All the panelists of this session are kindly requested to come for the photo session.
Good morning, ladies and gentlemen. A very warm welcome to this session at the India AI Impact Summit 2026, one of the most significant gatherings advancing the AI agenda across the Global South. RailTel Corporation of India Limited, a Navratna PSU under the Ministry of Railways, is privileged to organize today's panel discussions. As a national digital infrastructure provider, RailTel plays a pivotal role in enabling secure, scalable, and inclusive digital connectivity across India. Through these sessions, RailTel is proud to contribute to the national and global dialogue on harnessing artificial intelligence for public good, particularly in the domain of healthcare. To formally commence the proceedings, it is my honor to invite the Chairman and Managing Director of RailTel Corporation of India Limited, Shri Sanjay Kumar, a 1992 batch IRSSC officer with over 3 decades of experience in signaling and telecom. Associated with RailTel since 2002, he has been central to its growth, strengthening initiatives such as the National Knowledge Network and leading the expansion of nationwide fiber, data center, and ICT services. May I request you, sir, to kindly deliver the inaugural address. Please welcome him with a big round of applause.
Good morning, everyone present here. Respected Shri A.K. Verma, General Manager, Northern Railway, I am privileged to host you, sir, here today morning. I am also privileged to have Dr. Barnwal as a panelist, so welcome him as well. All distinguished delegates, panelists, and participants, I extend my sincere thanks to the Ministry of Electronics and Information Technology and India AI Mission for entrusting RailTel with the responsibility of curating these two important panel discussions at the AI Summit 2026. The central message of this summit is both simple and powerful. AI must create real and measurable public impact. Innovation alone is not enough. Artificial intelligence must strengthen institutions, improve service delivery, and enhance everyday lives of citizens. Healthcare represents one of the most important meaningful areas where this impact can be realized. AI has the potential to improve disease surveillance, support early diagnosis, enhance clinical decision-making, optimize hospital operations, and enable population-size health planning. However, technology by itself does not guarantee transformation. It must rest on secure digital infrastructure, responsible data governance, interoperability across systems, and above all, public trust. Our first panel will focus on how collaboration can strengthen public health systems. AI become impactful when various responsible agents work together in a coordinated framework. Public health challenges require collective solutions. The second panel will address an equally important dimension, that is of inclusion. AI solutions must work across urban and rural geographies, across primary health centers and tertiary hospitals, and across all socio-economic segments. The technology must bridge healthcare gaps, not widen them. Affordability, accessibility, and ethical safeguards must remain central to deployment. Together, these discussions aim to translate the summit's theme into practical pathways, aligning policy, infrastructure, and innovation to deliver scalable and inclusive healthcare outcomes. Before I hand you off to the esteemed panels, let me set the context with RailTel's vision and perspective. RailTel has evolved from a connectivity and data center service provider into a comprehensive solutions organization. Health has been one of our key focus areas where we have successfully executed few marquee projects such as Hospital Management Information System implementation on 700 plus railway hospitals, and one similar project we have done for Brihan Mumbai Corporation Hospitals Network. At the same time, we recognize the remarkable contributions of our Indian business associates that those are developing world-class healthcare solutions and addressing niche yet highly impactful challenges. RailTel's strategy is to collaborate with these Make in India technologies, offering integrated solutions that strengthen public health in India and extend to emerging economies. With that, I declare the floor open to our esteemed panelists to take this important conversation forward. Thank you. Jai Hind.
Thank you, sir, for those inspiring words. Ladies and gentlemen, we now move to panel discussion session 1. This discussion brings together eminent leaders from public health, digital innovation, and policy. And it is my privilege to introduce our distinguished panel. As I announce their names, may I respectfully invite each of our esteemed panelists to kindly come forward and take their seat on the dais. Because of some emergency, Shri Prashant Warrior could not come today. In his place, we have with us Shri Ankit Modi, founding member and Chief Product Officer, Qure.ai. May I request you, sir, to kindly come forward and take your seat on the dais. Shri Sunil Kumar Banwal, CEO, National Health Authority. He leads the implementation of Ayushman Bharat and India's national digital health infrastructure. I request you, sir, to kindly come forward and take your seat. Dr. Anubha Gupta, Professor, IIT Delhi. Her work focuses on machine learning applications in healthcare technologies. Ma'am, please come up on the stage. Shri Vijay Navaluri, co-founder and Chief Customer Officer, Supervity AI, a global voice in enterprise AI transformation and population scale impact. Dr. Jan Filbert Nsengimana, Chief Digital Advisor, Africa CDC. He leads continental initiatives on digital health systems and data governance across Africa. A truly outstanding lineup of experts shaping the future of AI in healthcare. Please join me in welcoming our esteemed panel with a warm round of applause. Ladies and gentlemen, guiding this distinguished panel is our moderator for the session. May I now invite Principal Executive Director, RailTel Southern Region, Shri K. Manohar Raja, to kindly come forward and take his seat on the dais. He is one of the founding members of RailTel and a pioneer of digital innovation, whose landmark initiatives include RailWire broadband and station Wi-Fi with Google that has transformed connectivity and value creation across Indian railways. We now move into the panelist discussion. I request each panelist to kindly confine their remarks to 5 to 6 minutes. With that, I now hand over the proceedings to our moderator, Shri K. Manohar Raja, who will guide us through this session. Over to you, sir.
Thank you. Hello and good morning, everyone. Thank you. The buzz and energy in this room is palpable. I'm sure something great will come out of this. We are very privileged to have Dr. Banwal, the CEO of NHA, amidst us. We have Jean-Philbert Nsengimana, the Chief Advisor, the Chief Digital Advisor of Africa CDC. We have the poster child of Make in India for the world, Qure.ai here with Ankit Modi. We have Vijay Navaluri from Supervity, who has the largest AI workforce in the world. So we have, and to represent the media, we have the academia, we have Dr. Anubha Gupta, who has significant contributions in this area, and she will balance the different perspectives. So before we dive into the proceedings, I would like to take a few minutes to set the context. And I also would like that we have short answers and have multiple rounds of question and answers so we can feed off each other. So I think that will bring out the best in the panel. So public health has always been about seeing patterns early. Who is at risk? Where are we failing? How do we take the next action before the crisis hits? AI can sharpen that vision. We have seen through various deployments and POCs that AI has solved problems, can predict disease outages, can do surveillance at scale, optimize resources effectively, and shape public health decisions. Even from an economic perspective, we have seen that if you focus or move to an area of a paradigm of early detection and risk mitigation, we tend to have save significantly in the long-time systemic costs. In our country, where we have a significant doctor-patient deficit ratio deficit, AI can be that force multiplier which can enable our existing workforce to handle large and diverse populations with higher precision and clinical effectiveness. India has shown what digital public infrastructure can create. UPI just did not change or modernize payments. UPI showed the world a global reference model. With ABDM and UHI, we are building the foundations for something even more transformative. I believe that AI could be, but if you compared to finance, health is much more complex. In finance, you have structured data, standardized transactions, and with a few parameters. Health is probably moving to more unstructured data, probabilistic, complex with hundreds of variables, and high-stake decisions. AI could be that layer which can build and create capacity for high explainability, very strong governance, and the ability to build in very low risk tolerance. In fact, AI can be that layer which can UPI-fy UHI. And considering the spirit of the summit, we can get a bit more ambitious, and I'll leave you with this last thought for the panelists. For decades, health innovation systems have always flowed from the West to low and middle income countries. With DPI, that equation has changed. What if, instead of relying on proprietary and extractory platforms, we are able to create a public digital infrastructure using the best of talent and the vast data resources within our countries, and create a UHI powered by AI with intelligence, with ethics, sovereign capability, population scale health system, built for and in the global south. Thank you. So I will leave you with this. I'll start with you, Ankit. You know, for a health startup in this area, you have had an incredible journey establishing yourself in more than 100 countries. What has been your journey like? What has been your learning? And how do you think that learning will help with public health?
Sure. Thanks, Mano. You touched upon a very good point with respect to UPI. Before our country could get debit and credit cards to every nook and corner of the country, we directly hopped onto UPI, which is contactless payment that the world is still catching up to. Similar example 20 years ago was before we could take landline phones to every village of the country, we directly hopped onto mobile phones. So India has a tendency of jumping hops when it comes to technology. And I firmly believe that we are ready for the same hop in healthcare, where AI and digitalization are going to go hand in hand, and India is going to lead the AI revolution in terms of its implementation in public health systems. Now, when you look at something that is very new and very cutting edge, what we have seen is that, take iPhone for examples, right? When the iPhones came for the first time, they are usually limited to the upper echelons of society, and then trickles down to, like, sort of say upper middle class, then middle class, and probably never reaches the most neediest part of the population. With AI, we are seeing the exact opposite. We are working with governments across the world and even in India, where we are seeing the latest cutting edge technology deployed in public health systems and directly benefiting the most needy part of the population. And that has been tremendous to see. On the journey, like when we started out in 2016, it was a very simple idea that if Facebook can detect images from normal photos, can we build similar AI algorithms to detect diseases from medical photos, right? Which is where we started out on X-rays and CT scans. And fortunately, we became the first ever AI company in the world to get published in the Lancet, which is the most reputed medical journal. And because of that, we gained a lot of trust, a lot of evidence came out around that. And eventually in 2021, WHO cleared us to be used in reading chest x-rays for tuberculosis, even without a human being in the loop. And we went to countries like Malawi or Timor-Leste, where there is 0 or just 1 radiologist for the entire country, right? We have multiple x-ray machines taking x-rays, but just nobody to read them. And that is where AI created its greatest impact. Screening for tuberculosis, then we expanded it towards screening for lung cancer, and that also became a huge value add. We just completed a pilot, statewide pilot with the Goa government, where this AI was deployed across the board, screened more than 200,000 people, which is basically 5% of Goa's population, and was able to detect cancers much earlier. And not only detect, it also proved that the diagnosis time was reduced by 50%. In some of these diseases, 50% is life-saving. We see stories of patients every week, every month, where an early detected cancer basically means that the person gets to live for 10 more years, 12 more years. Also reducing the cost on the health systems. Because we are talking about public health systems, a cancer detected in stage 1 compared to stage 3 or 4 means that the burden of treatment on the health system is much lesser. A TB detected 2 years earlier means that it has not spread to friends and family, and thus there are less patients to take care of 2 years down the line. So all of these things come together to create a great value add, and we have been able to sort of deliver this not just with AI, but going beyond AI. You can sit and build an algorithm, but what it takes is really working with these hospital systems, public health systems, and making sure they are being used right at the edge of these systems to create real impact, to save actual lives. Till date, we have touched around 4 crore lives all over the world, and we are on course to touching 100 crore lives by 2030. And we are adding more products, more AI capabilities towards that vision. But it has been an immensely satisfying journey, creating something out of India and taking it across the world for everyone to benefit.
Thank you, Ankit, wonderful. I'll come back to you for the follow-up question later, but now to Dr. Banwal. Sir, over the last 5 years, India has built one of the largest digital health public infrastructures in the world. While the infra story is phenomenal, the outcome validation story is emerging. How do we plan to leverage AI for governance and outcomes?
Yeah, thank you. I think many of you may be knowing, National Health Authority was created to implement world's largest government-funded health assurance program, which is called Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. When it was launched in 2018, it did not just implement the scheme, it also created a huge IT infrastructure for transacting all the details related to treatment of the patient, including the claim settlements by the hospitals and all. And that is how we have more than 100 million patient treatment records available, though not fully structured, but it is there, and I believe there are more and more tools coming which will actually structure this data for usage, for training of the models, and also for doing all kinds of research, including disease prevalence, surveillance, and this will give a lot of idea about future course of action which AI proposes to, and that is how this is one of our biggest strength India has, where you have the data of more than 100 million patients, and this is not just data of one geography, it is whole of country completely diverse data, because from every part of the country people are being treated, and it truly represents India because the beneficiary who are covered under the schemes are bottom 40% of the country's population. So this is one big advantage we have. But more than that, what was started in 2021 was very interesting for the country. Country launched this Ayushman Bharat digital mission, and this digital mission was with an objective to create the digital public infrastructure for the healthcare. And the aim was to have a national digital health ecosystem, because if we know the health sector and every one of us interact with the health system, as of now it is highly fragmented healthcare. You go to one hospital, you get the treatment, you have the record generated, it remains there. You carry the copy of the reports and you preserve it till the time next time you have to go to another hospital. You carry that same document, show it. Many times doctors will like it, may not use it. And then similarly, over a period of time, you might have visited several hospitals, several pharmacies, several laboratories, and might have got huge number of reports. But what did you do with that report? Could you anyway use that report for any kind of protection for your own health? Could any research be done that what kind of people are getting what kind of disease in which area? Which age group has got prevalence of which kind of disease? Do we have any analysis done of that? I think it was very difficult, because the data created was in such a form that it did not empower the patient to hold the whole longitudinal history of his own health. So this was first time being addressed through the Ayushman Bharat digital mission. And the whole objective is to connect these health systems. So if we keep patient in the center, and any health record which gets generated belongs to the patient, we will start seeing that systems must talk to each other. And patient should be in the command of the record, with whose consent the records can be shared. This is what the digital mission does. We have created 3 registries, which is registry of patient in the form of Abha ID. Many of you may be having. Today we have around 86 crore citizens having Abha ID. It's an Ayushman Bharat Health Account ID. This is the identity through which the records can travel from one system to another system, keeping everything in the hand of the patient. Second registry is the registry of health facilities. So we have hospitals, we have pharmacies, we have laboratories. They don't talk to each other. So unless we have the verifiable identity of each of the facility by which they can be uniquely identified, we will not be able to talk to each other. And that is why the second registry is extremely important, and that was created. As of now, we have around 4.5 lakhs facilities on this registry. Similarly, third registry, which was much more important, was to have a health professional registry. Health professional registry included all the doctors, nurses, paramedics, lab technicians, allied healthcare professionals, so that they can be uniquely verified and given identity. With these 3 registries, what is happening is now the sharing of record, exchange of information is much more possible. Now with a unique identification of the patient, with a unique identification of the facility and the professional, you can actually use it to share the record as per your wish. And now, what this exchange does is, it doesn't store any of the data. Data still remains with the hospital. Only thing is, it is now created electronic health record. And data is linked with the patient ID, which he can see on his personal health record applications. And so he gets empowered. And then the exchange only has the address. It doesn't have any storage. So it has the address, it knows where the data is. So in future, if we really want to develop a model and test the model, you actually use the address and ask the data. With his consent, actually you can leverage the health record being created across the country. So this is extremely important, and this digital public infrastructure, probably there are very few countries in the world which has created such infrastructure. The challenge, of course, lies on adoption. Many more facilities, everyone has to come on the system. Patient has to become empowered enough that they can demand their digital records. And somehow this is taking time, and we need to actually collaborate to ensure that more and more records get created electronically. They get linked to Aadhaar ID, and the patient can hold it in his mobile. So this is one. Similarly, it also opens up the possibility of having unified health interface. It was talked that how UPI was created. You see, the NPCI was creating the backbone. Nobody knew that, few years down the line, it will become such a powerful tool in the, poorest of the people living in the remotest part of the country. But it happened. Nobody had thought that point of time, but it had the digital public infrastructure in place which could leverage this. And this is what ABDM will leverage someday when we have all the health facilities connected. People will have access to all the facilities using his Aadhaar ID. Every facility would like to be on the platform to get the visibility. Every professional would like to have the visibility to see, have the visibility through the identity. And now, tomorrow, if a patient, let's say in Delhi, needs a skin specialist, he doesn't have to call his relative or his friend to find out who is the best skin specialist. He or she has to just go on the platform. Every facility will be visible, and then can he or she choose nearby with available slots for the appointment, etc. And it can be leveraged for blood bank, for ambulance services, and many more. And I think the kind of infrastructure we have created, what we need is more and more application to run on it. And with AI, we are seeing huge value that if we really use this infrastructure, actually we can leverage AI to scale very fast. And this, I think we have started doing it. On the one hand, we have more than 100 million data on which a lot of applications can run. We have already been using it for fraud detection, and to the extent of almost 630 crore we could save in last 1.5 years, only by application of AI ML tools to detect anomalies against the historical data which we had. So this is the potential which exists in the healthcare. I'm very happy to see the kind of response, the people present here showing a lot of interest in healthcare. And it was said rightly, in the finance sector or in agriculture, application of AI improves efficiency in a big way. But the risks are, you may lose some money, you may lose some crops. But in healthcare, it improves efficiency, capacity of the professionals. It also improves the clinical efficiency by using technology. But at the same time, sensitivity is much higher. It relates to the life of the people. It has the privacy of the highest order. So with these concerns, I think responsible deployment of AI for using and using health data to deliver more is something opportunity as well as a challenge, that how as a government or the National Health Authority we will be using responsibly and allowing the AI tools to be deployed for public health delivery. One of the big things which is happening, and probably tomorrow we will be launching it, is to also develop an open benchmarking platform for health AI. We know in case of health, people come with a lot of AI solutions. And actually, they say it has very high efficacy. But how do you know that? Unless it is tested against the real data set of our country, and maybe even within the country, the kind of diversity we have on different data sets. So this is where we have developed this benchmarking platform with the help of IIT Kanpur, and there every AI solutions can be tested against the diverse data sets which have not been seen by the models before. And therefore, you can actually benchmark where these solutions lie. So before it is deployed at population scale, it is benchmarked, and that will be the responsible way of actually deploying AI solutions. It will build the trust, it will improve the confidence of people on using AI. Else we know many a times AI solutions trained on a foreign data, not specific to our context, might be a misleading solutions too. And therefore, we are taking a big step by which we can responsibly deploy AI in healthcare, and this is a challenge which we will be able to meet using our digital health infrastructure.
Very, very comprehensive answer. Thank you very much. Dr. Anuba, while AI can do all these amazing things, it can also amplify biases and widen inequities. So is AI going to be the next great equalizer, or is it going to be the force multiplier, widening existing gaps?
So thank you so much. And I'm really very happy to listen to Sunilji because he touched on many points that I really wanted to emphasize in this. So first of all, to be honest, I wouldn't say that AI is responsible or creates inequity. What I would say is there is an existing inequity which AI would actually potentially scale to a very large extent. And how and where? So let's understand. So what do we want from healthcare solutions? We want healthcare solutions which are deployable anywhere in any part of the country, at any clinic or at any hospital, irrespective of where it has been developed. Now, he touched on solutions which are built on foreign data. Are they really employable or deployable in our context? So we have seen that the disease is really specific to the biological diversity that we have in the population. So the genomic landscape that we have, the mutational landscape that we have, they're really different for different populations. The exposure to environment risk, the exposure to microbiome, they really make a difference in how the drug would actually respond to a particular disease. So that really makes a difference. So that is why we say that ethnicity really matters. So do we have those sorts of curated data sets in the public domain where people are able to build solutions? So when we come to that, we really find that India is a country which is huge. We have such a diverse data set that we can collect. We are a populous country. We have variety of, like, if we just talk about diversity in language, eating, terrains, we have so much of diversity. So we are in a way mini world. But when we talk about our data, we find that the data is unstructured, fragmented, not collated, not curated, not properly actually connected with each other within a hospital or within even a small clinic. One department will not be connected to another. So the entire data is scattered and we are not able to utilize. Government is funding so many projects, even to academia as well as hospitals, and we do collaborative projects. But we do find that the data are collected, but they are not collated and deposited, which is where the government is now headed that we should be doing. So there is a data heterogeneity, that data is not structured, is not accessible. How would you build solutions which are India specific or which are specific, which can actually take care of this ethnicity and diversity into picture? Then the models are developed. The models are developed, they are also like, one hospital would be collecting data at a different protocol, another would be collecting at different protocol. So I would say, for example, if I just talk about MRI, the research is going on since I would say decades. But when it comes to whether a solution developed at one place, is it really deployable anywhere? You will start saying, no, the data is collected at different dimensions. So maybe one person is collecting at 1 mm slice thickness, another is collecting at 5 mm slice thickness. So the protocols are not same. Machines are different. So one is collecting on Siemens, one is collecting on 1.5 Tesla, another is collecting on 3 Tesla machine. So your SNR is different. So many varieties and so many variabilities are there. Then India is not a rich country. At least we are really progressing fast. But when it comes to deployability of the solution in our rural areas, can we really deploy those MRI scanners in PHCs? Then that means that we need to come up with the solutions that are also deployable. They are low cost, they are deployable, they take care of those. So we
Yes,
really
Dr.
need to
I
take
understand.
our AI to that
I think
part.
inequity is a very wide subject. There's so
Exactly.
many parameters in which you
Exactly.
play. So we'll come back to you.
Thank
you for this illuminating response. Phil, I'll go with you next. As the head of Africa CDC, you are an important voice for the global south. Our countries face similar constraints, limited resources, workforce shortages, fragmented systems, etc. Do you think an AI-powered public health can help you leapfrog from the conventional trajectory to the healthcare you desire?
Thank you so much. Thank you. It's always a pleasure coming back to India, and I'd like to thank the organizers, RailTel and Qure.ai, for allowing me to participate. I would say that for the global south, AI is not a luxury. It is a necessity. We face big constraints. All our speakers have talked about fast-growing population. Africa and India, we're talking about 1.5 billion people and increasing. We have constraints in terms of financial resources. We have constraints in terms of human resources. And for us, AI is the opportunity, not just to keep catching up to the rest of the world, but to leapfrog and potentially lead in this space. But for us to get there are 3 important things that I summarize in 3 I's that we must be very bold and deliberate about. Number 1 is infrastructure. And I'm talking here about the public digital infrastructure. This is a domain where India has shown global leadership. Without a public digital infrastructure, we can continue to see the very beautiful pilots that are sprouting everywhere, but that are not able to scale at national level to solve problems at large scale. So previously, we used to look for solutions coming from north or west, coming south, but this is changing. There is this conference, and the fact that we are having this conversation show that cooperation to solve the infrastructure that we need in the next century for health can be a South-South solution and collaboration. Number 2 is intelligence. Intelligence meaning that the one nurse that we have who serves many communities, having their intelligence in their hands, can really do things that only doctors could do. So we can create a multiplier effect on the few resources that we have. It is intelligence that is able to understand the local context and local languages, but also the intelligence at national level to allow government institutions, National Public Health Institute, ministries of health to make informed decisions and optimize resource allocation. And third I is impact. This is what this whole summit is all about. Impacting people's lives, reducing maternal mortality, reducing the time it takes to detect outbreaks and to respond smartly to outbreak, to deploy resources for response in a more coordinated way. So if we can partner on developing those three I's, I think we not only catch up, but we leapfrog and lead, and that's a call to action I'd like to put to all of you. Thank you.
Thank you. Very illuminating. Vijay, over to you. Actually, while a lot of AI is used for insights, I think you have a very different approach to it. You're focusing on outcomes. And that is the holy grail of everything. So can you tell us how you're going about it?
Absolutely. I mean, I think CMD sir in the inauguration speech, he spoke about outcomes, right? Technology is there, but outcomes, where are they? First of all, pleasure to be here. Mahol bahut acha hai. India won the match yesterday. So all of us are feeling good. Thoda mahol kharam hai uda if there is an upset. But, our colleagues, my friend Ankit also mentioned, India comes late, like to quote superstar Rajinikanth, we come late but we come latest, right? So we do things in a different way. At SuperVT, our mission was to make AI a force multiplier for humanity. Right? That's why we started the company. We do a lot of work on enterprise and governments, but when it comes to healthcare, like you mentioned, we think really different. We should not need more hospitals. We should not have more doctors or medical professionals. We should have lesser patients, right? If we can make lesser patients, the infrastructure can scale. So the energy and the entire, if one single thing AI and all the 1,000 things it can do for humanity is about improving health, right? If you look at the impact, it can do automate jobs. A lot of us are scared about AI coming for our jobs and many things. But AI is a force multiplier when it comes to things like health, right? We don't have enough resources. We don't have enough of anything when it comes to managing healthcare. So can we move away from thinking healthcare to wellness care? And like you mentioned, AI can orchestrate those outcomes, right? A lot of us are, many of us must have gone through the experience of that bad report that we get in the family, that midnight hospitalization. All of us are scared about these things. Can AI really change it from moving from sick care to wellness care? Can it make the biggest impact, the agentic AI? Can it orchestrate the providers, which are the hospitals, the payers, which are the insurance companies, and the pharmas, which are the medicine companies, and most importantly, the fourth one we are talking about, Dr. Sunil mentioned. I'm so proud to hear what India is talking about, digital public infrastructure in healthcare, and the kind of energy and passion that they are bringing to the table here, that the fourth P is going to be public infrastructure. It has to play a role. If you can bring these four ecosystems together, and agentic AI is the invisible orchestrator, orchestrating outcomes between the patient, keeping patient in the center, right? That's how we see, agentic AI, and AI can really change from being, sick care to preventive, agentic prevention as this holy grail of healthcare.
Oh, really, breath of fresh air. Really, if you can stop feeling people falling ill, that's the best kind of healthcare
we don't need more hospitals, we need less patients, right? That's how we all have to start thinking. And we should have, if you just can add one point there, we should have, we all have CIBIL scores for financials. Maybe I'll request here to Dr. Sunil that if we can also come with, personal health score for every one of us, so where we can really measure where we are and have a personal AI coach, which for every Indian citizen, right, and globally eventually, to drive the outcomes from the score from where we are to continuously improving the health outcomes, right? So these are the things I think we should be really looking at, how private ecosystem like us, we can contribute open source health AI command centers, we can, agentic AI technology, and, the DPI can actually look at the governance of the data, governance of how AI can be, utilized across ecosystems. So we'd love to look at some of the big ideas and socialize with them as we go along.
Thank you. We'll have another quick round. Let's keep our answers short and sharp. Ankit, I'll come back to you. I want to understand, now we're talking about the health startup industry. Today they have two paths. They can take this long path of building their own models, like how we all did for machine vision, or you can work around use cases of frontier models. What are the choices? What should we do? What is in the interest of DPI?
Great question, Manoharji. See, for us, it's never about starting from the technology and then finding out the right problem statement for it. We have to always start from the problem first. What do we want to solve? Like, we want to save lives in an economically viable way, sustainable way. Then is like, what kind of solution do we need to build for that? And then what are the technologies required to build that solution? So when there was no imaging AI 10 years ago, we built our own imaging AI, trained it for 4 or 5 years, core R&D, acted like a core R&D lab, and came up with our chest X-ray AI solutions. Last year, we launched a product called IRA, which is ambient scribing for primary healthcare centers. There, again, the question was, we want to, again, empower digitization in as fast manner as possible. What is the best pathway to that? Maybe open source models fine-tuned on our own data sets. So always start from the problem. And like I said, Qure is a very young startup, bustling with energy. And that is where a partnership like RailTel...
So, Ankit, we're running short of time, so a short answer, please.
Yeah. So that is where like a partnership with RailTel, with like people like Sanjay ji and Parag ji at helm, it will really work out in the sense that with their experience and our energy, we can create something meaningful for the country. So in short, like just start with the problem first and then figure out the technology needed to solve for that.
So Dr. Barnwal, you touched upon it actually when we spoke about DPI. So when DPI, everybody agrees it's the way for health to go. It's so important, you can't leave it to any proprietary systems. But how do we build it? In the sense, how do we build DPI? How do we, after all, it's so complex that we need the talent and the energy of the private sector, and still it has to be owned by a public entity. Can we have some models around what you're thinking?
See, the Ayushman Bharat Digital Mission, the DPI which has been created is a completely open, interoperable, federated architecture. Somehow let us be very clear that there is no complexity. Actually, it has been made much simpler. And you see, today, people can say UPI is so simple. It is really simple. But of course, the backbone has been prepared, the detailed architecture. That is what we did in ABDM. The architecture which has been put in place, only requirement today is the hospitals, the professionals, the patients, they need to see the value in it. See, when we say this, every patient feels they need to have their whole record for last 10 years, 20 years, 30 years. We all need, but I don't know if people sitting in the hall knows last time when did they visit the hospital and what medicine they took, or what symptoms they went to the hospitals, and what was the treatment provided. Will they use it next time they visit to the hospital? Will they be able to explain to the doctor in a clear terms that what exactly the symptoms were and what medicines they had taken? I think many of us will fail.
Right.
Now, with this architecture in place, the challenge lies is the patient need to know the value of it. Hospitals need to know the value that if they create electronic record, it will take care of not just the efficiency of the hospital, will also build the huge digital record repository with the hospital, which they can also analyze, of course, with the consent of the patient, with the anonymization, etc. required. And more so, if we are part of the same health ecosystem, every hospital will benefit. Let us not think in isolation that if a patient
you're
comes
saying,
in
sir,
the
it is finally boiling down to awareness and incentive.
Awareness and incentive. We have started an incentive scheme for using more and more facilities to come on the digital health system. Many of our people are still on a manual prescriptions, examination, etc. These all have to transform to electronic system, which are integrated with the larger ABDM architecture.
Right. Thank you, sir.
So this is what will have to happen.
Thank you, sir. Dr. Anubhav, I'm coming back to you on this because I think you are addressing always a different perspective. But you were saying that low-resource health systems are very important. Multimodal systems are more important. Population-aware systems are more important. Can you briefly touch upon it? We have less time, so a short answer, please.
So I would say as of today, the models should be representative of the population, should ingest data from different population, should also be built using multimodal data, your demographic data, clinical data, lab data, genomics data, imaging data, etc. So that not only we can do early disease diagnostics, means not only treat the patients who have already advanced in the disease stage, but also do early disease diagnosis. Mass screening should also be possible within the Indian context so that we can early catch on those disorders. And I would say the models would be different unless they have seen that diversity, they would not be able to actually do both.
Thank you, Dr. Anuva. I just have time to squeeze one more question. So if you don't mind, I'll address that question to you, Doctor.
Yes,
so we have the head of NHA here, and you are the head of Africa CDC. What kind of South-South collaboration do you think will be really impactful?
Well, I see him as my twin that I had not been able to find before, so I hope to have a bit of a conversation right now, because I think the South-South collaboration can be in terms of human resources. There are so many Africans that come to India for training. Myself, I'm an alumni of the SPGN School of Global Business. So, and I happened to be part of the first cohort of computer science trained graduates in Rwanda, and all our professors came from India at that time. So that South collaboration is happening and just needs to be strengthened. And finally, I learned one thing, that when you have a microphone, you have to sell something. Otherwise, you have lost an opportunity. So I'd like to sell something here. I'd like to invite you to those who are interested in doing business in Africa, and especially in the domain of digital health, to join us for the Africa Health Tech Summit. You can type healthtechsummit.africa. It's September 30th to October 2nd in Kigali, Rwanda, and this conversation can continue. Thank you.
Thank you. I think we are about time. I'm sorry I'm not able to do some more questions. Thank you. Thank you, panels, for the lovely discussion. Thank you.
Thank you to all our distinguished panelists for the rich and insightful perspectives. We are running short of time, so we won't be able to take questions from the audience. Ladies and gentlemen, as a mark of our appreciation, we will now present mementos to our esteemed panelist and moderator. May I invite Director Network Planning and Marketing, RailTel, Shri Yashpal Singh Tomar, to kindly do the honors. Please welcome him with a big round of applause.
Qure.ai, and they're handing over the reports as well. Due to shortage of time, we're not releasing it formally.
Yes, please. Yes, sir.
Yes.
Sir, come. Idhar aa. Sir, please come this. Ma'am, please. Sir, excuse me. Sir, just one. ये मोबाइल पे लेने थे चारों तरफ से सर everyone please look here sir one more please sorry yes sir.
Thank you once again to all our distinguished speakers for an enlightening discussion. This concludes panel session 1. I request all the esteemed panelists to kindly step down from the stage so that we may proceed with the next session. Ladies and gentlemen, we have just concluded a very insightful first session where our speakers highlighted how collaboration, digital infrastructure and AI innovation are transforming public health delivery at scale in India and across global context. Building on those powerful perspectives, we now turn to the next frontier. We request the audience to kindly remain seated as the next session will begin shortly. All are requested to remain seated, please. We are going to begin the next session shortly.
और एक ये नाम कहाँ जाएगा आपका हाथ में
Ladies and gentlemen, we have just concluded a very insightful first session where our speakers highlighted how collaboration, digital infrastructure and AI innovation are transforming public health delivery at scale in India and across global context. Building on those powerful perspectives, we now turn to the next frontier. I request everyone to kindly be seated. Panel session 2 will focus on the theme AI for inclusive, accessible and universal healthcare. This discussion will explore how technology can translate into equitable access, affordability and better outcomes for every citizen. This session brings together distinguished leaders from healthcare delivery, research, technology and public policy. As I announce the names, may I respectfully invite each of the panelists to kindly come up for the photo session. Shri Rajiv Sikka, Group CIO Medanta. Professor K. Srinath Reddy, Founder President, Public Health Foundation of India. Shri V. Ram Manohar Rao, Director Finance, RailTel. Dr. Anshul Vikram Pandey, Founder and Chairman, Pan Science Innovations. Shri Atman Jordan, Co-Founder and Tech Lead, Supercriticals. I request the panelists to kindly take their seats. As I announce the names, may I respectfully invite each of our esteemed panelists to kindly come forward and take their seat on the dais. Shri Rajiv Sikka, Group CIO Medanta, a leader driving digital transformation in one of India's foremost healthcare institutions. Professor K. Srinath Reddy, Founder President, Public Health Foundation of India, a globally respected public health expert and a guiding voice in health policy and systems reform. Shri V. Ram Manohar Rao, Director Finance, RailTel, and Indian Railway Officer, Account Service Officer, guiding financial stewardship and governance for RailTel's growing national digital mission. Dr. Anshul Vikram Pandey, Founder and Chairman, Pan Science Innovation, an entrepreneur building AI and deep tech ventures across healthcare and critical nation sectors. Shri Atman Jordan, Co-Founder and Tech Lead, Supercriticals, working at the forefront of AI-driven diagnostics for underserved and resource-limited communities. This session will be moderated by Dr. R.S. Mani, Distinguished Scientist and Head ICTD CSIR, a respected leader guiding national initiatives at the intersection of science, technology, and societal impact. May I request our moderator to kindly take his seat on the dais. Each panelist will have 5 to 6 minutes for their remarks. A short buzzer will sound at 5 minutes and a long buzzer at 6 minutes. May we request you to kindly conclude at the final buzzer. It is my privilege to now request Dr. R.S. Mani to kindly take over the proceedings.
Good afternoon. The sessions are like Dil Mange More, so it never ends. Huh? So I'm going to make it very short and crisp, and especially after Mahashivratri, it is better to stand. It will be difficult for me to sit down and otherwise you will sleep. So let's come back. In the previous session, we saw that how the public health AI is impacting the public health. However, on the jovial side, someone talked about, like Sybil, we must have a health. I hope it is kept very confidential and not really given out. It will have a huge social impact otherwise. So coming back to this session, in this session we'll try to take our narrative towards universality and then governance, trust, and then see how AI, if enabled with the DPI that we talked about, the digital public infrastructure, and the techno-legal framework as well as the ethical framework as and when it comes out, is able to do an early detection and probably help the healthcare to reach every nook and corner of this country. Today we are faced with a huge diversity, population diversity, which Dr. Anuba talked about. We have also seen the financial diversity and access diversity. So it's extremely important that whatever AI can throw out on this is able to take us to that level so that with minimum cost, we are able to deliver healthcare. So with that, what our aim is today in the discussion is, as everyone, no one likes a guardrail, okay? So even I'm not used to a guardrail, so I've been told to do it in a particular way, but I'm going to shift it in a different way. But don't worry, I won't eat your lunchtime, so we'll close at right time. So what I'm going to do is that I would request each one of the panelists, because we have very senior panelists who've got a huge experience, and then entrepreneurs who have created their companies. So it's extremely important to understand how AI in their area of work, and all of them are working on healthcare and also infrastructure. So how is it going to help the public in general? How is it going to make AI inclusive, accessible, okay? And inclusive, accessible, and more important, universal. So let's have a look at each one of the panelists for a few minutes, and then probably we'll generate few questions and then end the session accordingly. So with your permission, I would like to start with Sikka Saab, who has been CIO and huge group. So obviously he must be having a wonderful experience of AI in his field, and let's hear him out on how AI has enabled Medanta and what is the future for AI in his company right now. Thank you. Yeah, please, you can sit there because I have to stand. I was not sleeping last night, so you can sit.
Sure. I think the topic itself says that AI for inclusive and accessible health. We are almost on the 80th year of independence. Freedom fighters, including Mahatma Gandhi, thought about two important social dimensions. One, education, and second is health. And I think, folks sitting in this room and even outside will agree that both of them are in shambles. Right from the first planning commission, we thought that we will have inclusive health commission, but no butter on any side of the bread, no political colors. I think in 2018, when ABDM was launched, first time, very clear-cut tech-embedded healthcare policy was formulated. So the kind of gap which we have in the country, be it the facilities, be it the skill, be it the tech, or be it the insurance penetration, we will never be able to reach that gap, and this gap is going to grow exponentially. Only thing which we can do is that either you have less sick people, which one of the earlier panelists said that, which is not going to happen very soon. The other is that you bring tech, and that's the only way by which healthcare can be scalable, can be accessible, and can be affordable. I will give 2 examples of AI, nothing in theory. All of them are in production in Medanta. So these are not theoretical stuff. So guardrails, risk, all have been taken care very well. So one example is that we have been running TB-free Haryana for last 11 years. I think this is the biggest CSR which we do outside the tertiary case. Now we run TB-free in 5 other states where we have our hospitals. When we started, we used to take a van, and you have to understand the meaning of accessibility now. We are talking of Haryana. We are talking of districts which are like 20 kilometers away from Delhi or 30 kilometers away from Delhi. You are talking of everybody understands traceability after COVID, but we were aware of traceability, and we were tracking traceability for TB way back in 2014 and 15, because someone rightly said that one TB patient, and TB is more infectious than HIV. India TB load is 27% of the world population, while our own population is roughly 14-15% of the world population. So having said so, now, when we started running this program, we used to send one radiologist in a van. So roughly in one single day, we have 200 odd subjects who were there for TB screening. I have been to those vans, and for us, timely detection on the same day and very fast is important, because these were all dihadi workers. I learned this word called dihadi workers because they used to say that, sir, do it fast because meri dihadi miss ho jayegi. For him to find TB in his body, that non-latent TB versus dihadi was more important. So one thing which was happening is that we used to do the picture of the scan, because radiologists can see limited number, and then send it to folks in the Gurgaon headquarters, and then delay definitely used to happen. And a lot of times picture was not perfect. So all that story, cutting it short, COVID happened, and then we were short of radiologists, because radiologists also got involved in doing HRCT. Now everybody remembers what was HRCT during COVID days. So we thought that let's have an AI box in the van. Okay, great. But where was the 2G or 3G connectivity on those remote areas? So definitely AI van was a failure. So second thing which we did is that we brought the AI module back into the box, which is attached to an X-ray modality, so which means in local AI. Now how do you improve the machine learning, which Dr. Nurma spoke about? So we used to bring the van back to Medanta Hospital. We used to upgrade the algorithm each Friday night so that next Monday morning it is ready to use. Now what we are saying is that in this particular case, we were able to detect TB or no TB within 30 seconds of an X-ray coming out of the modality. So just imagine that, which was taking couple of hours, where the dihadi worker is not around, and then you have an X-ray machine giving you an X-ray in a DICOM page format and giving you a possible TB for the subject or not. Definitely this is, X-ray is a screening test in the case of a TB, because it's easy to do but difficult to read because radiologists were not around. So sputum test and then ASHA worker took over, but for last 5.5 years, we were doing roughly 6 vans, 4 days a week, 200 subjects per day, per visit. So multiply it, not even one single X-ray is read by a radiologist. So that's the power and accessibility and affordability of AI in production, at least in Vedanta. This is primary care, and I'll talk about one more example on agentic AI. I think I have to tell you 2 aspects of the stories. Both of them are personally related to me. My mom, once I took her to Medanta Hospital, obviously everybody knows me, so doctors are also aware. So one doctor gave one prescription, mom rejected it. Second doctor, next day, gave almost the same prescription. Mom was not aware which prescription is this or which doctor is this. Academic hierarchy, nothing was known to mom. So next day when we asked, why the hell you took, second when the prescription is the same? She said that at least doctor was speaking to me. Doctor was looking into my eyes. So patient want doctor to speak. I have another example. My daughter is a doctor. So she does practice. So she generally have 30 minutes for a consult. She's outside India. So she is at 20 minutes patient are talking nonsense. They don't talk about symptoms. Doctor only kick in the OPD is to convert the symptoms into a diagnosis. That's the kick. Okay. And now for 20 minutes, patient is saying that, my son came, he brought such a beautiful shawl. At 21st minute, doctor is switch off. He doesn't comprehend what patient is saying. So there are two different contrasts. Doctor wants to cut short, listen to the symptoms, say the diagnosis and go back. Patient wants doctor to listen. So we came out with agentic AI with this principle, where conversation between doctor and patient is happening in an agentic environment. Agent is listening each of the conversation. You come and visit us. It speaks in Bhojpuriya language. It speaks in Maithili language. Because we have hospitals in Patna. Okay, and then each and every prescription is ready, structured. Uh, there are brands, there are generics, there are instructions in the local languages, there are general advice in the local languages in case the patient is interested in the local language as a prescription. So what I'm saying is that, and plus doctor get a lot of satisfaction because he's not focusing on time. Most of the senior doctors, they use keyboard like this. Okay, so for 20 minutes they are typing the prescription, for 5 minutes they're looking at the patient. So what we have done is that we have ensured that doctor focus on the conversation, on empathy, on breaking the ice rather than on the keyboard. So this is one more example, and there are multiple byproducts of this.
Yes, Mr. Rajiv, I think you gave a good example of Rajiv's mother having the right, which is called a patient autonomy, to throw away the prescription when she doesn't want it. So it may be the same next day, but she has a right to throw it away. So now I think we'll go to Dr. Srinath and take his experience on public health and how AI is impacted.
Well, let me start off by saying what was actually advocated as a very important prescription for the health system of the country if it has to deliver universal health coverage. We need an efficient, equitable, empathetic, and economically viable health system if we have to deliver universal health coverage. The critical elements of universal health coverage are adequate service coverage to cover all the essential health needs of anybody across the entire life course of the individual. The second element is that these services should be delivered with quality but with adequate financial protection so that they are not either hindered from seeking care or driven to bankruptcy because of the care. Now we know that about 6 to 7% of the Indian population every year, this is from the National Sample Surveys, are pushed into poverty because of unaffordable healthcare expenditure. We also know that there are several people who do not seek care because they're worried about the expenditure or because health services are not easily available because of geographical access barriers. This is basically foregone care. Now, if you don't estimate foregone care, you will get a false understanding of out-of-pocket expenditure. When people are not even spending, then you say, okay, people are not really having too much of out-of-pocket expenditure. So to find out how universal health coverage is working also, we need to get that. But the critical element is that AI has helped and will help even more in bridging some of these barriers of access. It will also bridge barriers of quality. It will help bring down the costs. Now, important element, of course, is that we do have a serious gap in the distribution of our health workforce. There are states where there are adequate number of doctors per population ratio, but there are several states in which there are very few doctors distributed, and even in most of the states, there is the urban-rural maldistribution. So if services are not reaching people, to train non-physician healthcare providers with diagnostic algorithms and management algorithms on handheld devices, point-of-care diagnostics, and enable them to give appropriate care at the point of care, or even train people for self-care, train family members for care. All this AI can greatly bridge the gaps that are there now and ensure people will get care at home, close to home, and in an affordable manner with appropriate triage for referral when required. So therefore, the overall service coverage component will improve. The quality of care will improve with these kind of algorithms being very clearly stated and distributed, the healthcare providers being trained, and even the patient or the family being able to check whether they're getting the right treatment or whether they're being advised the right kind of tests or not. So we are democratizing the health system in enabling people to actually participate in their own healthcare in a much better manner. And the financial costs also will come down because people don't have to travel far. People don't have to take unnecessary tests and treatments. So all the objectives of universal health coverage are going to be definitely satisfied. But there is health beyond health care, and which means that we are also looking at prevention, promotion at the community and the population level. Again, here AI can help tremendously in very many ways in enhancing public awareness of the conditions through health and nutrition literacy, enabling people to undertake a lot of preventive care themselves so that they don't fall sick. Because somebody was saying in the previous round that you can't prevent people from falling sick. Yes, but you can certainly reduce that risk by enabling people with much better knowledge. The other element, of course, is there are disconnects in the health system in terms of referral. Right now, we have primary care under the health and wellness centers or the Ayushman Arogya Mandirs. We have secondary and tertiary care being subsidized or financed by Pradhan Mantri Jana Arogya Yojana. There's virtually no connect between the two. And the disconnect between the primary health care as well as secondary care and tertiary care can easily be bridged by AI in a substantial manner. We have seen how telemedicine has been functioning, telehealth services have been functioning. So we can actually ensure that the expertise of the specialist is available to the primary healthcare center as well. So we can bridge the quality gaps that are there in our healthcare while ensuring better access, ensuring also that the financial barriers are lifted, and ultimately all the objectives of universal health coverage can be much better served.
Thank you. Now I would request Rama to give a little bit on the infrastructure as well as what he has got in plans for AI.
AI is intelligence part of it, and finance is incentive part of it. Unless you incentivize the entire system, universal access is not possible. I mean, AI is actually revolutionizing entire healthcare scenario, wherein if you look at this primary care, if you are going to push more, and the burden on the tertiary care will come down. The preventive part of it, what Dr. Sikka has also spoken about the tuberculosis, and also many such kind of examples like diabetic retinopathy, sepsis. There are many use cases wherein the sepsis was detected and per annum 2,000 deaths were come down to 500 in a particular hospital. So that kind of preventive thing will reduce the load on the tertiary and secondary healthcare systems, and that will enhance the affordability for the general patients and public. So that is one area actually this AI is going to play a major role. And as far as the other aspects, I'm from finance, that's why I'll try to look at it from the finance angle also, wherein the benefits should be available to all the players in the entire ecosystem. From that perspective, earlier we have been listening to NHS director where he was mentioning about the fraud detection part of it. And AI is a tool where fraud detections can happen, and then public spending where around 3% of GDP is being spent on public healthcare. And there may be a lot of leakages. These leakages can be plugged. And coming to other point, as far as the risks part of it is, normally technology means we go by technology solutionism, thinking that technology is all pervasive and technology will be it will give the right prescription. But many a times may not be, because it is involving data, and the data what we are gathering might be having so much of biases. This is one area where international discussion also is happening. The data on which the entire systems are getting trained. And the data intake may be biased from various perspectives, sometimes maybe on racial perspectives, sometimes on geographical perspectives. And most of the data might be Western data on which we might be training also. So this kind of systems which got trained on these kind of I should not use the word lopsided, but not relevant databases, the solution also might be different. So there comes whether the trust factor about the technology, what it is giving solution. From that perspective, and also data being very private and sensitive to everyone, especially the individual health data, it is very, very sensitive data. A federation of data is very much important, in the sense that the data can be trained by respective hospitals in their local systems, and without having any specificities and detailing about the individual data, that data can be duly giving the weights and the activations, then that can be shared across on a portal kind of thing. So that kind of systems are very much essential, and that also makes this universal healthcare very much accessible. Unless the data, localized data, Indianized data is getting trained properly, the solutions also may not be right in the perspective. So that's why the data, sensitization is very much important. And also, I foresee a lot of opportunities in this sector, especially tech companies and startup companies kind of thing. Now, huge data is getting trained, but that can be containerized, that can be quantized, and it can be made readily available to the end users and end, mobile level and end device level, wherein this kind of data trained models on a low memory based systems can work even on low internet. There is no internet available in rural areas. There also they can be useful. And that is another area which can make this universal access possible. Because universal access means what, to my little understanding, I think experts are there here, to my little understanding, whether primary, secondary or tertiary, all the three layers of the healthcare shall be available to all the citizens and individuals equal footing. And that is a very, utopian kind of thing, but technology is one which can really make it closer to us. And obviously, the various kind of technologies that are coming, like multilingual chatbots or interaction with the patient that can get recorded and then replayed again, that kind of systems which are going to proliferate in shorter period of time, and then we can see everyday life using these kind of technologies. So now finally coming to this part, because I am from finance, we need to talk about the risk also. There are risk elements, what I have already flagged, and the policy comes into picture there. The government policy, which need to be very, very sensitive towards the usage of this artificial intelligence into healthcare, because it need to be patient specific. Because in the entire ecosystem, if entire ecosystem is running on finance and then profitability, EBITDA margins, that will obviously twist the entire thing, and it will not be in the favor of the general public and the patients. So that's my points.
Thank you so much. So, so let's hear about, Anshul, if you can just talk about a little on the technology that you created, and also a little bit more on the language and as Rama was talking about having the model in the car, as well as Raju was talking about it. So what have you done on that, and what are the difficulties that you have faced on this?
Sure. Thanks everyone for giving me this opportunity. When I'm surrounded by such esteemed panelists, I tried very hard to neither talk about policy, because I know very little about it. I'm not that well versed and domain trained as Sikasa there. I do not really understand the intricacies of how to run very large P&Ls either. So I thought, how can I really contribute meaningfully to this conversation? And I think over a period of time, I learned a lot more things. So let me just first briefly tell you what hat I'm going to wear today, right? And I'm going to wear the hat of someone who was historically now, because in AI world, 10 plus years is history. I was an AI researcher. I was briefly a professor. Then I built companies. I sold them. I spent about 14 years outside of India. And then I met my lovely wife, who's a doctor. And she said, hey, why don't we go back to India and really fix, hopefully, the whole healthcare ecosystem, right? And we thought of this name Parcha because Doctor's Parcha is very intrinsic to, and it's like a very household name to everything that we do. So I'm going to wear today the hat of someone who has largely been trained outside. Now, we do have some interesting access to technology, right? I'll be very honest. The access of GPUs and HPCs that I had in my university was probably better than what you'll find in some of the largest companies in India. And there was as much learning when I came to India as much as there was unlearning, because things that you would take as available to you there are not available here. So I thought I will just give you this picture of what someone who's trying to really push for AI adoption and empowerment through AI really faces today, right? And everything that I'm going to talk about are very much backed in data. And we have done so many deployments now that we are very integrated to this, largely this India AI ecosystem, not just healthcare either. In fact, most of these recent product launches and these foundational model conversations that you see, when you really unlayer them twice, you'll find a flavor of Pan Science innovations somewhere there. So there are, see, look, India has done fantastic work in digital healthcare ecosystem, like no questions about it. When you really look at the rails that have been paid, they are fantastic. I mean, we have hundreds of millions of digital health ID cards. We are running crores of teleconsultations parallelly. These are things at population scale. These are not even like a cohort or a silo scale. But there are a couple of very interesting challenges that we are going to all face. The first being, we have also talked about contextualization, right? So the AI being trained on Indian data, AI should be trained on Indian data. I will not go right now on the accessibility of the data aspect, right? How much of this already is still pen and paper? But when you really think about contextualization, so that is my first point, we faced the problem of contextualization not only from a point of view of data access, but also what Rao sir said with regards to even the bandwidth access, right? So when you're really doing deployments in these fringe areas, and we did some deployments in Andhra Pradesh and very remote areas of Telangana, these were deployments on mobile medical units, which have no access to internet whatsoever. Now you are resource constrained. You don't have bandwidth. You are internet constrained. So everything has to run on premise, right? Or at least on the device. And that means you are also going to be constrained by the kind of AI model you can use, right? So while we can talk about the benchmarks that yes, AI today has become 98% great in predicting certain things, when the rubber meets the road there, we are really talking about 75 and 78 and probably 82. So I think us as enablers as well as the ecosystem that will be empowered, we first have to really keep resetting our expectations to the nuances and constraints that we'll be operating under, right? And I think that kind of a realization and resetting around ecological validity is most important, because otherwise what will keep happening, we will keep comparing the hype with the realities, and that is not going to be that great. The second part, which is, I think that's one thing that I see lots of AI companies not doing today, is start to build any solution from the edge inwards. And what does that mean? In healthcare ecosystem, I call edge as the point at which the healthcare worker and the patient's interaction happens, right? So yes, you can build fantastic policy models. You can build dynamic pricing on insurance. You can build maybe great tools for radiologists. But I think that is the second part where we have seen lots of failures happening. In fact, last week we were doing a deployment, we were doing a pilot at one of the large hospitals in Delhi. And there were at least 10 conversations happening in the same room. So all those voice AI models that work really well in an air-conditioned office of a tertiary care large hospital are going to fail, right, and fall flat. So I think that is another part where you start to see nuances that you have to fix. And yes, of course, by doing some technical work, you can start to really get to a solution that works. In fact, that pilot, it seems that it was going well, so we'll know more in the coming weeks. And the third point, and that's the last point, I think that is a mindset shift that we all are we must have here. We have to, and I cannot emphasize more, we have to start to measure outcomes and not pilots. And what does that mean? If you ever come to my office, I have a quote there, we can only improve what we can measure. And it's absolutely critical that you measure the right thing. We have to measure, I mean, in dystopian world, yes, we have to measure how many people got longevities and so on. But today, we have to stop measuring success by product launches. We have to stop measuring success by pilots. We have to start measuring success on how many high-risk pregnancies were detected earlier, how many hypertensive patients adhered to their medication, how many patients' history were properly captured and populated in the EMR systems, right? I think that is where a lot of issues we do come across. The great thing is, and that's the optimistic view, and that's the last point I'll add, most of the things that you today feel are technically difficult, right? And we are probably just skipping the conversation because it's technically difficult, are all solvable today. In fact, 4 years ago, I gave a talk at NVIDIA around adaptive machine learning. And in fact, Parcha was a use case there, which was how do you really keep training the model as the doctor is giving feedback? At that time, we didn't feel that there will be a need for things like that. But today, you can see our histopathology system that was working at 60% accuracy, today is at 75% accuracy. So I think there's a lot of optimism in the space. I think there's a lot that can be done. At the same time, the constraints are very real and they have to be looked at.
Thank you, Anshat. So let's now get on to the topic where we will ask Mr. Jadon on how do we look at AI when we talk about personalized medicine, and as well as whatever you are doing right now, if you could enhance more on that.
So thank you for that. Yeah, thank you for that. Good afternoon, everyone. So I'll pick off initially where Sir left, right? So when we talk about AI that is inclusive, that is accessible, that is meant for universal healthcare, we cannot look at benchmarks in terms of model score, in terms of pilots conducted, in terms of demos conducted. The benchmark is systemic impact. Systemic impact in terms of time saved, money saved, continuity of care, especially where healthcare is stretched out thin. I do not come from the perspective of training a foundational model, but more from a perspective of creating, curating deployment pathways, healthcare pathways on the ground. And what we've seen is that healthcare becomes non-universal much before, due to human reasons, much before it becomes non-universal due to technical reasons. If I take you through a quick vignette of a diagnostic cum consultation setup that we have in a small town called Mahoba, the Jan Swasth Kendra as we call it. As patients started rolling in, we saw a very unique pattern. I'll say unique because, yeah. So a very unique pattern in which patients were equating good treatment with something that is fast. So by fast, what I mean is immediate visible intervention, be it strong medications, steroidal medications, IV drips, anything that will give relief faster, right? On the contrary, if a clinician prescribes a proper treatment plan with multiple follow-ups, something, a gradual medication, lifestyle changes, it is treated as hoax or perceived as hoax. So I'm not saying this to pass judgment on anyone, but more towards to bring light to what this births. Confusion-driven healthcare. Confusion is madly expensive. Lack of faster treatments, then talk about delays, treatment delays, unnecessary medications, lack of adherence. This is where universal healthcare breaks. Not just on access, but on understanding. So on the deployment side, what we observed were 4 common breaks in each and every deployment. The number one was the meaning gap. By meaning gap, what I mean is the lack of healthcare literacy pushes the patient towards understanding or towards chasing relief, faster relief. The new norm is something that is immediate. The second one is the interpretation gap. There's prescriptions available, there's multiple reports available, even with my grandmother, but these documents do not make any sense to her. A patient would not be able to tell you what their HbA1c reports mean, or they would not be able to tell you what why they're on 7 different medications in a single prescription. The third gap that we observed was variability. Healthcare is not consistent. It varies from doctor to doctor, from clinician to clinician. Definitely be a lot better in Vedanta when you compare it to a simple PHC. right? Be it due to the time variation, the time pressure, due to incentives to the doctors, to the habit, or due to just simple lack of standardization, this is treated as randomness or perceived as randomness by the patient. This randomness drives the patient to get to the most, or rather take the pathway that feels most effective instead of taking a pathway that is correct. And the fourth one is the navigation gap. Without understanding what to do next, it drives the patient, or rather makes the patient bounce between multiple referrals, multiple medical institutions, without understanding what to do next, and up until the symptomatic escalation brings them to a tertiary hospital, as one of the panelists said. In the tertiary hospital, increasing the load of a condition that could have been taken care of at an earlier stage, possible. So where does the AI come into picture, right? That makes it genuinely inclusive. Definitely not by making AI or transforming the AI into a doctor itself, not by making the patient act as a doctor, but by making the patient an informed participant in this entire process. What I mean by informed participant is making the patient a patient that understands what their health means, a patient that understands what their reports mean. So on the patient's end, I believe AI can essentially function in two simple yet powerful ways. Number one, understanding, and number two is navigation. Understanding what your prescription means, what the particular medicine is, which is a support medicine, which is required, which is symptomatic, and which medicines are just simple supplements. Understanding what your reports mean in plain, simple language, what it implies. And finally, creating a next step ladder that talks about what to take care of immediately, what is an emergency situation, what can be taken care of by a simple home remedy, and what requires a local clinician intervention. This reduces panic decision-making and unnecessary escalations, making inclusivity come into its true sense in terms of lower number of hospital visits, lower expenses, less hassle, less harm, essentially.
Yeah, please go ahead. Finish your last step.
Yeah, sure. So this only works with a bounded model, right? By bounded, I mean the AI must not prescribe, the AI must not alter dosage, the AI must be true and transparent in terms of communicating uncertainty. The AI's role is to explain, triage, and escalate. That's it. On the medical practitioner's end, the AI can act to make the consultations more safer and consistent, essentially acting as another set of eyes in a time-constrained environment. It can detect flag duplications, contraindications, dangerous combinations, and guide the consultation towards the medical guidelines. The key, ultimately, is that the final decision should remain with the clinician. On top of that, in cases of a high-impact choice, like prescribing a steroid, prescribing some kind of antibiotics, the system can ask for a separate layer, a single-line explanation or confirmation from the clinician, not as a punishment, but more towards inculcating a learning loop, and as well as to reduce the chances for doctors getting into an autopilot mode. Yeah. On the system layer, where universal healthcare essentially gets into an operational form, once we reduce the confusion and increase follow-ups, then we unlock prevention. AI can flag risks early, detect patterns, and prompt interventions, especially in cases of...
So I've got a question for you. Okay, now let's just start with a question, because maybe a question for you. You said explaining the prescription to the rural. So when you talk about a rural mass getting into the PSCs, very soon the doctor will not have time. So are you contemplating on a system which will generate a video with the same doctor speaking on what he has written on the prescription, so that he can carry it on the same language in which the guy speaks, so that he can refer to that whenever he feels like and take the prescription properly?
So we're not initially going for a video-based thing, because what we observed in our deployments is that although after Digital India mission, the advent of smartphones, advent of internet is there is penetration, but still a lot of people who will be visiting these hospitals are not very familiar with it.
Distance far.
Yeah.
Okay. So let's come back to one question each. I'll just put the question to Sikka Saab. You talked about x-rays, and lots of x-rays were taken. And I'm not a medical professional, but still I just thought that today I was just hearing about, the fundus, the retina photographs. They also not only talk about retina problems or proper retinas, but they also sometimes indicate about heart issues. So when you have taken those X-rays and collected so many of them for TB, yes or no, can those be, further worked upon? Will that be legally allowed, or I don't know, I'm not sure. But can that be worked upon to really find out many more things that the people might be developing?
Sure. So answer is 100% yes, because as I said that all guardrails, including privacy, including ethics committee approvals, are very much in place. I think, Mani, we have to understand that healthcare will bring, AI in healthcare will bring less problems than the problems it is going to solve. So we have to keep that focus in mind. Countries struggling with so many problems of the healthcare at the remotest corner, and we keep talking about problems of AI in the healthcare. That mindset should shift. We should think about, mindset should be not to, worry about what kind of best algorithm we will build. I think the mindset should be that how we build confidence in practitioner in using AI for the healthcare. That should be the mindset.
Thank you so much. Dr. Srinath, if you could highlight on some of the difficulties that you face, just one, probably the biggest one, when you talk about public healthcare policy making or any other accessibility, etc.
Let me say that scalability is the biggest challenge. Scalability of care across different parts of the country. Even scalability of some of the treatments that are available. Partly because we do not have the health workforce which is adequately trained and adequately distributed. But AI can actually overcome the scalability problem. There's also another element. When we are talking about universal health coverage, we are talking about equity. We have to identify vulnerable groups who will require additional attention, additional services, perhaps additional resource allocation. There will be equity in a horizontal dimension in which the package of services is identical for everybody. But there will also be a vertical dimension of equity in which the additional care or additional services or additional resources will have to be provided to vulnerable sections. Now, bringing in the social determinants of health is not that easy unless you bring in AI, which actually combines it with the health system indicators and identifies which are the vulnerable population groups, who are the vulnerable patients who require this kind of attentive care in addition to what is being part of the general package. So equity gap is something, and scalability gap is something that AI can overcome.
All right. So I have got one question last, very short answer for Anshul. You talked about the remote boxes where 72% of accuracy is the one which you can work with. And you also talk about zero connectivity, as Rama was also talking about. Now, when you scale the system into thousands and thousands of them, and tomorrow, obviously, the country will have wonderful connectivity. Today also, we have the cheapest of data rates. But then maybe very soon, within few months, if that comes, what's the kind of disruption that you think that, or would you use it for your own benefit? Just short, very short, because we are left with hardly any time.
All right. Sure. So I think this is as much a Wild West, the whole transformation in India around AI that's happening is as much a Wild West as we are seeing with the frontier models in the West. So I think two things are definitely going to happen. First is, as much as we are talking about the empowering the healthcare workers, we are actually missing out on how it is really going to enable the patient to be better aware of situations, right? I mean, there are going to be patterns emerging on the ground that yes, there are new knowledge on the ground that will be spread. I mean, most of the doctors do face this question, right? Khana kya hai? And like medical education, medical awareness in itself is a big problem. So I think that is going to be definitely impacted. Second part, as the connectivity happens, I do envision that we are going to see a very hybrid deployments that will happen.
Right. So you're going to take care with the hybrid deployment and probably make sure you take advantage of the connectivity that's going to come. So with that, I think we don't have any more time. So I would like to stop here and thank the panelists for their wonderful suggestions and takeaways on AI. And thank you so much.
And thank you for being the wonderful host.
Thank you. I think Dil Mange more, I need to speak, but I will do that another time. Please. Sorry.
Our sincere thanks to all esteemed panelists for a highly valuable and enriching exchange. To recognize the contributions of our distinguished speakers, we will now present mementos. May I invite Director Projects Operation and Maintenance RailTel, Shri Manoj Chandan, to kindly do the honors. Ladies and gentlemen, with this we come to the conclusion of RailTel's session at the India AI Impact Summit 2026. We extend our sincere gratitude to all our speakers, moderators, dignitaries and participants for making these discussions meaningful and impactful. On behalf of RailTel Corporation of India Limited, thank you for your presence and partnership. Have a wonderful day ahead.
Thank you, everyone. The next session will start in another 5 minutes. Kindly vacate the hall till then.
Hey guys, please vacate the room as the guests have to come. No. अब यहाँ से हो जाएगा ना रिमोट से भी ये तो मैंने इस पे करी मैंने वो बोलते रियलाइज करा मैंने
Good afternoon, everyone. I'm just happy everybody's sitting at this point and there's no one in the hall that has to stand. One of the benefits of a 200-member seating facility, I guess. So this is fantastic. Thank you all for joining us today. My name is Deepa Karthikeyan. I'm co-founder, partner of an organization called Athena Infonomics. We're an organization that specializes in evaluating artificial intelligence, right? And which is really what we're here to talk about. I've been instructed that we'll need to do a group pick before we get started. So I'm going to request my esteemed panelists to just come together for a group pick, and then we'll get started in a minute. Great. I think in one of the, I was in a session and I think there was a sentence that really captured the sentiment that maybe several of you, particularly if you're in government, are feeling. Do you want to be wasting money to be part of a race that you're not even sure is building or generating value? And I think that's an important question, right? And it becomes even more critical when you're spending scarce public financial resources subsidizing design, innovation, and delivery of artificial intelligence services. There's a value for money question, right? Is there value for money from this investment today? Do we need to wait? There is a safety question, right? Which has been a really large part of a lot of the discussions that I've seen since this morning. And there is definitely an inclusion question, right? Which is, you could say, oh yeah, this is great, there is value for money here, but it may not be inclusive yet, right? And achieving those goals require us to go back and think about questions of how we collect data, how we build models, how we finance those models, and how we actually drive adoption. We have some phenomenal panelists today, so I want to really, and if time permits, I know 55 minutes is tight, but really allow for some sort of audience interaction and Q&A as well. But I want to kick us off. So we have here with us Zeba Siddiqui and Francis, who are both evaluators, who are going to come from the perspective of really what is the evidence telling us, right? So there was a systematic review that was funded by FCTO that Francis and Zeba were part of leading and delivering at Athena Infonomics, and they're going to share, Zeba will share the results, and then Francis will share how that's shaping our thinking as we think about AI evaluations. We're really honored to have Dr. Piyush Singla join us, who's Secretary Information Technology, the state of Jammu and Kashmir, who's really thinking about questions of how do you do this at scale and how can we make sure it's inclusive, and what do we need to get right in terms of the digital infrastructure on the upstream. And Professor Kavya, who's joining us from IIT Delhi, who's going to touch on this very critical aspect of adoption, which will not come without the trust infrastructure at the last mile and the human interface, and what we're learning through the work that she's been leading and delivering on. With that, I'm going to hand it off to Zeba to talk us through what we're learning from the FCDO systematic review. Clicker.
Thanks, Deepa. Thanks a lot for situating Athena's work in this landscape. As she mentioned, this was a rapid review that was commissioned to us by the RCC FCDO Government of UK, University of Birmingham, and International Initiative for Impact Evaluation. The idea behind this was to map what kind of AI solutions or AI-enabled interventions are being used for what kind of agricultural problems. Now, having said that, we were also cognizant of the fact that we not only want to map it in a very technocentric manner, but we also want to understand what are some of the welfare-related indicators related to agriculture. I am drawn towards the point that one of the panelists in the previous health-related discussion they alluded to is that you have to also measure the right kind of outcomes. So in order to do that, we embedded rapid review, a very rigorous methodology with more qualitative and narrative-based methodology in order to cull out the more relevant, the more well-informed and well-rounded sort of details in terms of how does it impact smallholder farmers across Global South, across lower and middle income countries. I'd quickly mention what are some of the key evidence base that we found in this study. And then I would also discuss a little bit about what are some of the qualitative or narrative-based details that came or that were generated through this study. We looked at over 55 journals. We also looked at around 19 to 20 repositories, both academic and organizational repositories. And we also looked at over 100 grey literature, just to ensure that we're not missing out on anything relevant. And the time frame that we included in this study was from 2019 to 2024. We realized that there is a lot of dialogue around effectiveness of the AI models, of the AI interventions. However, where a critical gap lied was the fact that we didn't have much dialogue around what is its impact on poverty reduction, livelihood, decision-making power, and who does the decision-making power rest with. There is also, we did find that there is a lot of impetus on using AI models around crop production, pest detection, precision agriculture models, large language models, but they were directed to, or the studies or the evidence were essentially directed to understanding how are these effective, how are these solutions addressing or faring in terms of performing or not performing. Again, there was a lot of, in previous discussions, we see that there is a lot of dialogue around, not just measuring the pilot, but also measuring the sustainability of those interventions. This is something that we realized when we were doing the rapid review, and which was sort of also came up in the case studies and the deep dives, is that the AI models, especially in agriculture, are much at a very nascent stage, at a very pilot stage. We do see surge of a lot of supply side designs where AI is sort of being seen in agricultural practices. However, those models do not sustain. I'd briefly like to touch upon why do they not sustain, or what are some of the challenges that we encountered. And these are the gaps that we identified during our analysis. Firstly, adoption-related challenges is essentially driven by lack of trust. The limited amount of trust is because we do see, agriculture is essentially a very conventional, a very traditional field, wherein we see that, people from a certain generation, they're not ready to take that financial risk in order to take up a new technology. Hence, there is lack of adoption, and there is also the lack of trust in terms of, adapting to something that may or may not lead to the desired sort of outcome. So we also realize that, behavioral changes are very difficult to overcome. Sure. I'm actually not reading through the slides, so that's fine. You're not using the slides at all? No, I mean, it's just, I'll just, because I have my notes made, so yeah. So in one of the case studies that we studied, that we did in the African context is based out of Kenya, where we realized that a lot of cooperatives, farmer cooperatives that engage farmers, are also disseminating a lot of information in terms of how to use AI-enabled solutions for financial services, for banking services, and so on. While this is a good avenue to percolate information to the right kind of audience, what we realize is that these cooperatives, also called SACCOs in the local context, did have high amount of male membership or male concentration, as opposed to women who were not traditionally part of these organizations. Now that brings us to my second point, is gender disparity or gender inequality. AI that essentially has been sort of brought into any field, even in agriculture, to balance out that inequity, in a way also sometimes, not always, perpetuates these inequalities, in the sense that when we are trying to model anything in a particular context, it also has to be cognizant of what kind of context it is being tested in. It also has to be aware of what are some of the cultural gradients that are, that are prevalent in that particular environment. What we also realize is that human-in-the-loop design or human validation is something that is a challenge, and that is not being talked about enough in terms of the evidence. We do see inclusivity is something that is missing in the evidence base or in the literature, and we, when we talk to stakeholders, we talk to large cohort of people, from academics, from donors, to research organizations, and there is one thing that they definitely debated about, or they sort of argued about, is that human validation or inclusivity in that sense is something that should be at the very core of the design of any AI solution. And any solution that is being designed for ag-related problems should not just have technical experts, but should also have people from gender, from local community or community champions. Then we also realize that there is a big capacity building gap in terms of providing that kind of training to farmers to be able to not just adapt, but also understand these solutions. Digital literacy, as we all know, is a big challenge, and that also hinders the adoption of these AI-related solutions. At a large scale, what we realize is that governance or governance-related frameworks, AI frameworks, exist in a lot of geographies. However, ag-specific frameworks are missing from the discussion. So this is something, this is a definite policy takeaway that, of course, Francis would talk about it later when he talks about the horizon mapping from this entire project. But absence of ag-related governance or ag-related policy framework are a definite evidence gap. Absence of localized data or using average assumed data from national data sets, or absence of consent or taking consent from the farmers in terms of how the data is going to be used, is also one sort of dialogue that is missing from the evidence base. We also realize that there are financial constraints, there are financial sort of functions, indicators that are attached to using any AI-enabled solutions in agriculture. While a large-scale farmer may use may function at economies of scale, a small-scale farmer may not do so, which is why there is a definite inertia in terms of adapting to these solutions. Again, coming back to the gender point, there is gap in terms of ownership of assets, ownership of land, ownership of smartphones, or even basic, these kind of paraphernalias where women are sometimes at the fringes and not at the very core of these solutions. Financial inclusion is also a big problem when we're talking about enabling financial services through AI interventions, because a lot of times women are also left out from the banking sort of sector or formal banking networks. So these are some of the gaps that were flagged during our study, and I think I would just leave it to the fellow panelists to sort of allude to these points and also talk about them in details. So yeah, that's all from my end. Deepa.
Thank you, Zeba. A quick question before we go to the next panelist. Is there something that surprised you from the systematic review? We know about the digital literacy stuff, we know about the finance and scale stuff. Is there something that came out of that systematic review that you went, whoa, I didn't expect that?
I wouldn't say surprise. There were a lot of expected sort of evidence that emerged during the study, but something that really does, I'd say that, a lot of these solutions which should be directed at smallholder farmers, which form the majority of the group, are not directed towards them, are not made for them. Or even women who do not own the land, however, they are sort of forming a majority of the labor who are sort of performing, the daily labor at these lands. Why I say this, as I mentioned also, is that they're not part of the, the circle who owns that particular agricultural land, and hence they're not part of the solution as well. Which is why they could be at the other end of the spectrum using these solutions, but they're not at the other side wherein, they can contribute to the design side or the, the supply side, or how do you want these models to look like and all of those things. So this was definitely not surprising. I'd say expected, but yes, this is perplexing in a way that, you're not really addressing to the very core of the problem, or you're not addressing to the larger group, which are going to be your majority sort of, the user group. So yeah, that was something that
Thank you,
emerged.
Zeba.
Thanks,
Francis,
Deepa.
do you want to come in?
One thing that really surprised me in the literature was we have shortlisted about 450 studies and then included about 51 studies. But the number of studies that did not report even basic what type of data they used for training those models, and what are the ground truthing, and what are the ethical issues that they looked into was really surprising. Like there's very few studies I've actually kind of like looked into and reported that in the final like a report. So that kind of really calls for a sector-wide like a checklist or like a reporting standard that everybody should follow.
I love that. I think, so we're hearing at least three things, right? We're sort of, firstly, we don't know. There isn't a lot of evidence on impact yet. Where there is some evidence, the impact hasn't lasted or sustained. It's very temporal. It's very projectized. So it's clearly this, and this is such a great segue, Dr. Singla, really, right? Because now is in government, when you're starting to think about how do you build systems and how can you approach this in a way where impact is delivered, where it matters, and is sustained. And that's a question that's true beyond artificial intelligence. I think we can draw from literature on public service delivery. We can draw from literature on good governance and where that's worked. I'd love to hear from you, building on your experience on, how you're thinking about it in Jammu and Kashmir.
Thank you so much for having me. I think this is a very pertinent point to discuss. We do have pilots across the sectors, so do we have in agriculture as well. But issue is institutionalizing those pilots. And that's where comes the biggest challenge. I see it very differently. From the AI use perspective, there is some sort of FOMO, fear of missing out, that if you are not doing anything, you are missing a huge thing. For sure, we are missing the huge thing, but most important is to do what is actually required on the ground, which has the adaptability, which has the uptake from the local population. For example, if I talk about Jammu and Kashmir, I've been there for last 14 years, working in different capacities in the senior administration. The farms of saffron farms in Pampur is very different from the apple orchards in Sopore. So it is very different in the rice fields of Jammu. So we have very diverse geographical regions, very diverse needs, very complex behavioral issues. So we cannot actually put in just one dimension that look whether this pilot will upskill or not. I remember we were doing, when the PM Kisan was launched, so we were interacting, I was the district magistrate of Anantnag district in Kashmir, so we were interacting a lot with the farmers, small marginal farmers. They have their own set of needs, own set of requirements. So unless any AI model speaks the language of a farmer, that upscalability will always be, I'm not saying a technical language per se, but how the trust develops. So in government, when we talk of scale, we talk of trust. So it is a service actually. It is not a small pilot you run in one district and suddenly it fades off in 1 year. That will not be adapted. It will only be upscaled, adapted when it is as a service. When farmer needs it, you provide it. So it's a transaction. It is every day's need. So if they want the weather advisory, so because the farmer will not wait for the seed sowing. So if he needs the weather advisory right now, very accurate, so he need to get it today. So if I say, okay, there is some algorithm problem, so my model drift is there, so I'll wait for 3 days, so his time is gone. So he'll lose a precious time of seed sowing. So I believe this is the real practical challenge which we see in AI these days. There are very beautiful pilots around and with a great intention, just that it has more adaptability on the ground. The system is adopting that, models, and we are upscaling it in the interest of the public, so the last mile is benefited.
I love that. And I think this is why it's always exciting when government's in the room, right? Like, because that perspective and mindset and is so unique to a public sector leader. What is Jammu doing something about this already? Are there initiatives? What's being done, for instance, to address the last mile advisory that without latency, that is highly reliable?
That's the most challenging part of it, actually. So we, educational institutions, especially higher educational institutions, have a bigger role to play. We have IIT Jammu. So we are collaborating from the Jammu and Kashmir government side to come up with the Center of Excellence. Again, the mandate of that COE would be to create use cases which are actually upscalable and replicable and based on the needs of the ground. So we all must be knowing about the Daksh Kisan, that there are a lot of AI solutions, AI platforms, where weather advisories and other kind of things are given. But to have it more comprehensive, without latency or minimum latency, and suiting to the geographical needs of Jammu and Kashmir. The farmer in Jammu needs a very different advice than my farmer or horticulturist or orchardist in Kashmir. So that variance is huge. So we have to have those models which actually help with that. So our COE would be taking up very few use cases rather than what actually feels from our side it can be taken. No, we are thinking from the maximum problem perspective. So when you have unscheduled rains, when snows, untimely snow and sleet can damage the full apple crop. The full season is gone. So we are trying to work on those use cases and trying to come up, most important is the data, in my opinion, right now. So we are coming up with good data sets so that we know what is the trend of last 20 years or 30 years about the weather advisories, how the forecast has been, what my farmer needs in that space. Then we can feed that data to the models in collaboration with the academia, industry, and can come up with the real use cases which are upscalable, rather than just pushing very less data from small district level sample size, which we do not want to do.
Lovely. So this, I think, and I struggle with this, right? As someone who's operated at the intersection of research, policy, and practice. We need policies to be designed to be scalable. But the reality is it has to be highly customized and bespoke, right? And that's a difficult intersection to navigate, right? Because when you're designing a new program or a policy, you're making some assumptions about what impact could look like, and you're operating with certain principles of how you will deliver that. Now, in the absence of feedback loops, right, we're never going to really know if the policy is really working or not. And that's a really, and this is a book that I love. It's called Seeing Like a State, which kind of talks about why public sector schemes fail, right? And at the heart of it, it's not because of intent or even complex political economy dynamics. They go on to say it's because we just don't learn. We have no way of learning cost effectively on what is and isn't working, so that our policies end up being static documents and systems that are stuck in bureaucratic inertia rather than allowing for dynamic engagement in terms of what is and isn't working. And I think that, Professor Kavya, probably is an area where I'd love for you to come in, because you've been thinking and working on questions of how do you do that? In practice, we all know it's important. We know there are challenges, right? Like, none of us in this room will say otherwise. We need feedback loops. But how can we build those systems of feedback loops and dynamic accountability and policy responsiveness?
Thank you for having me here. And the work done by Athena itself speaks so much about the need of the concept itself and then the scalability, the data which they have collected. Much appreciated. So coming to the question, I would say that agriculture, healthcare, and welfare schemes, they are the source of big data in our country. And they should be treated like a big data source. They should not be treated like a lab scale work. We make policies, but then if you see our trajectory is from pilot to policy. This is a very wrong way, because pilot is a very, very controlled experiment. I do experiments in my lab, and the same thing when I take it out in the field, I know there is a small field, there is a village, a cohort, a specific demographic I am addressing to, I know the crops, and I am hand-holding that particular small group. So that is a pilot which I want, and then pretty much I am also interested that these are my expected outcomes. So everything is kind of framed in a predictable manner. Whereas, and then we very merrily compile those pilots and then go on and make a policy for the population or for the public. Now, this is where the disconnect happens, because we do not have multimodal data. Pilot is very, very limited to its frame boundaries, or when we can say it has its own boundaries which it has created. Whereas agriculture is different. Agriculture, I'm not touching upon healthcare, but it is no different than this. Speaking for agriculture exclusively, it is a multimodal sector. You just can't look at a picture and say that, all right, this is late blight of potato. You need to know which month it is, what variety it is, what is the soil condition, what weather you are growing in, what state it is coming from. But when we are when we are developing the models, we do not have a point where this multimodal data is integrating or collecting. So what miss is the accountability, because even if you see the advertisement of the ChatGPT and all, what are they saying? You ask a question and then they respond. But at the back end, there is a whole lot of training which goes inside. And if this training is not on Indian system, if this training is not hyper-localized, if this training is not repetitive, that means feedback models, as she rightly mentioned, if there is no feedback loop or a constant learning, we do not have, saying it is self-improvising, that would be technically a little too alarming. But yes, the system should keep on improvising itself, because the continuous data is coming in. And where is this data coming in from? The multimodal sources which are at different positions in the country. Like rice, for example. Pan-India, we are growing rice. Pretty much all hybrid rice we are growing. So what is the problem in collecting the data from the different states? We would try and have our own area. This is our area where we are collecting the rice from, and then we have this data 10 times. Same area being repeated. There is no diversion, or there is no extra data which is coming in, or an alternate. It could be a flood-borne, it could be a zinc-heavy soil, it could be a farm practice which needs to be improvised. Not everything needs a flush of pesticides. But generally, a static trained model will give you a static trained response. And the worst part is there is no accountability. Wherever we are talking about trust factor, farmer feels, all right, now earlier you used to come and talk to me, now you have a device which is coming and talking to me, but what if it goes wrong? Even when farmer is standing in the field with traditional knowledge, with his all seniors and ancestors and very well experienced people, still things go wrong and there is nobody to hold accountable to. And then we expect him that this is the device, it should replace all your wisdom, all the experience, and this is the best thing to be. The world is just moving on moon right now with this device, so you just take it. And if you don't take it, he rightly said there is fear of missing out. You are no more the mainstream person. So there itself we are creating the layers, and these layers are kind of filters which are filtering the profit, which are filtering the benefits, which are creating barriers to accessibility and also to improvisation. A person or the group of people or the villages which are technically smart, accessible, having a good bandwidth of internet, near to city, having good smartphones, women usually excluded because either they do not have a smartphone or they do not have the time to do it. So we are kind of narrowing down with the data, with the users, and also with the area from which we are trying to train our problem, which we are trying to train our model. So in a way, I would say all of this, again, this becomes multimodal itself. If we have to make a policy, it should just not be pilot to policy, it should be policy at scale. Scale data should go into developing the policy, public to policy, not pilot to policy, where trust is embedded. I strongly speak for embedded AI, which is akin to embedded finance. For example, your WhatsApp and Airtel phone, they were not traditional banks, right? But then they allow you to make payments. Google, they allow you to make payments. As simple. In your existing smartphone, you have a payment making agency sitting there. As simple. You don't need the know-how of technology. You just need to have a bank which is somehow linked to it, and somehow you can make a payment. That is the user aspect of it. If we are able to make embedded agriculture, embedded AI for agriculture, the farmer should not feel, oh God, one more app. What do I do with it? वो पिछला वाला ही नहीं काम कर रहा है. It is not helping me anymore. And then gradually there is a trust deficit. So, and then it all feeds into, whether we want to acknowledge it or not, it all feeds into shallow policies. There is no feedback mechanism. There is no impact assessment of these policies. And then there is no improvisation or recovery mechanism that, okay, this didn't work, let us do that. And the last and the most critical thing is, if something goes wrong, who's to be held accountable? Because he has everything which can go wrong, and then he has nobody who will compensate or hold his hands for. So highest stakes lies at the last mile.
I love that. So I sit on the board of a crop insurance company, and we've been joking about this, and maybe it's not going to be a joke too soon in the future, is an insurance product for AI, right? So what happens? Who takes the liability of an advisory going wrong? And what's being built into advisory agents today, right? For instance, I'll give you an example of a pest management platform, right? They don't want to take the responsibility of what pesticide you use. So the farmer still makes the decisions. You simply provide a connecting bridge to, for example, a drone-based service or a mechanized human facilitated service. So it's still just a matchmaking facility, but you're not taking responsibility for advisory yet. I think that's a really powerful point. And I also want to, I think you touched on this so elegantly, exclusion by design, not inclusion by design. You talked about how, you know, and again, we've talked about this, sometimes poverty is a policy status quo. It's not that by design you are perpetuating or maintaining a state of exclusion. These are such powerful points. I know Dr. Singla, I mean, one of the disadvantages of being the only public sector leader on the panel means, I don't know, like, these are very complicated issues, right? Like, as researchers, it's easy to sit here and think about it and write about it. And I think there is a role that we play, in a way, as mechanisms of evidence and accountability. But when you start thinking about practice, what's the thinking in government today about questions like these?
I think the most powerful point was accountability. So you cannot let AI to drive your car, and when someone, you know, if that car hits someone, someone can just get scot-free. Someone has to be accountable. That's why in government, when the systems are designed, especially all the pilot projects, very carefully it is seen that whether that has a relevance for the last mile, it may or may not touch, but is there a relevance for the last mile? Here comes the role of data is very important. So I personally see we have so many departments which are data rich, but unfortunately the data is not granularized in a form and shape where there is interoperability. So to have that data layers, interoperability, we need to have more systems of data sharing. In J&K, we are attempting to have some data lake concept. Data lake concept is a new concept where every department pull in their data. If you put AI layer over it, then there's a uniform reply. So we have seen a case study where if we put AI to one department, the response to a same query will be different than if I put AI to other departments' data. It's the same query, but the response will be different. Why? Because the data is in a different form and shape. So datas are not talking. So we have so much of data. So I think the most important critical right now, in our opinion, before we put any AI layer for any use case, is to have good data interoperability, good data exchange, which data can speak to each other, good form and shape of the data, which can be fed to the systems for training our models, so that we all talk of model drift, we talk of model hallucinations, very common words. But if our data is like that, what model is going to do? They are going to behave like that only.
Absolutely. I want to, and I know, Francis, you've been thinking about.
I'd just like to add one point. Sorry for this interjection. There is, if you just ponder upon it, there is a little bit of a stark difference when the models are made for healthcare, because there the jargon remains with the doctors. And that is consistent. Anywhere in the world, you would have typhoid called as typhoid and TB called as TB and cancer called as cancer. But when it comes to agriculture, the jargon sits with the farmer. And that is extremely, extremely diverse. I mean, we have language, we have dialect, and then we have household language, generational word for a thing. So creating a data lake and interoperability of the data becomes so crucial and critical in agriculture, and this should be addressed first, because for the same thing, you will have so many different words which are coming. It is just not how you describe your problem. Somebody would say stomach ache ho raha hai, somebody would say पेट में कुछ हो रहा है, somebody would say I am not feeling comfortable, and then doctor would understand based on the treatment reports. But in agriculture, it doesn't happen this way. So it is very, very sensitive, like a thin glass we are walking on. So data pipelines should be very well structured, culminating into data lakes, and then data talking to each other may possibly be a way wherein we are addressing the big data of agriculture, including all levels of dialects and even household language for a word.
Amazing. Gosh. Maybe, Francis, I'm going to make your job harder then, in a way, right? If you, because as an AI evaluator and as a sort of having spent a lot of time thinking about this and working on this, Francis, you've been trying to come up with almost like a framework to navigate this complexity, right? That ties in the interests and the incentives and the practical considerations that governments lead with, but also what we know is important from a technology governance regulation standpoint. And finally, an impact standpoint, right? In terms of what we know and what matters, right? Like, while the language might change, we've now worked across different states. The two biggest things every farmer wants is better prices and affordable inputs, right? In fact, credit is the third. Like, if you could address these two, and then credit, in fact, dependence on credit goes down. So at least the needs are universal. At least there's enough convergence on some of the core things that has a huge impact on their quality of life. But Francis, how, if you were to sort of think about a framework, how would you go about doing it? And do you have advice for governments and practitioners and researchers?
Thanks, Deepa. Yeah. Both Dr. Singla and also Professor Kavya ended their like part with a very difficult question, like said the accountability question. When something goes wrong, who's accountable? Who's like responsible? And they also like talked about like there are several challenges that actually kind of leads to, like say lack of interoperability of data or lack of feedback from the end users. All that kind of like leads to this like a problem. But like put the question differently. Like we have like lots of pilots from, that's what we see in the literature review as well. But then almost like none of them have actually kind of like moved on to like kind of scale to kind of become part of the like public infrastructure. So what would we need for a pilot to become a full scale like project? Like say like what type of like an evaluation or governance architecture that we need to like put in place, like so that that we are kind of like confident of the final like results. So along with the literature review, we also did like series of case studies in Africa and also in India. So from those case studies, like what we have actually distilled like 3 like buckets of like issues that that we would need for ensuring that the pilots, when they move to like a scale, we could be like relatively like more confident of the results that like could like come out of that. Like so, the first like a pillar is actually the model safety, the model verification, that pretty much almost like all the like model like builders, their application like engineers would actually do. They would be like looking at the consistency of the results that coming out of the model, the efficiency like of the model and so on. But in the framework that Athena has actually developed, the question that we actually ask is like beyond like model like safety, like we are asking like model safety, like for whom? Like this has been like say the engineers do like a stress testing like for different types of inputs that like Professor Kavya talked about, like say the inputs could come from in varied like fashion because of the language actually changes and so on. So the model could be like tested in the lab like testing, but like was this really tested with like people in the real world like testing? So that's like for the basic like block for model safety. Like say a government that is expecting an AI model to like, be scaled, or like a donor that's actually aiming to fund this should be asking like a series of like question on the internal validity of the model itself, like what data this has been trained on. Is that being trained on like localized like a data that's specific to the context? And again, like just quoting like Professor like Kavya, in AP that's what like we see in Andhra Pradesh. Like within a vicinity of like a 20 kilometer, we see there is a massive difference in terms of like say the pest incidents in like oil palms, like because of like a difference in soil, like moisture, like a soil quality, like weather, and so on. So the model needs to be trained on ultra like micro level data. So that the kind of like checklist that we should be looking at to begin with. The second block, again, Dr. Singla talked about, it's actually the trust and usability. So we should be actually asking question, is the model being tested in the real world with the people who would be ultimately like using it? Do they really understand the model? Or the model producing, like say, it could be like a chatbot and advisory, does it really produce outputs that are like relatable to them? Is it culturally, contextually like relevant like to them? And then there is another angle. So the end user is one group of like stakeholder. Then there is also the last mile workers who work with the farmers, who are another very important stakeholder in this human in the loop like whole process. These are the people who could actually like build the trust. So this like say extension workers like who've been working with the farmers, there is actually a level of trust that they enjoy. And now if we like build these models jointly with the last mile workers, like say your like say like the support team or like the like red team as we call in AI like language, that if this team includes the last mile worker themselves, and if the last mile workers own the model and could like really interpret the final output, that will increase the level of trust like for the like farmers to like take the like results. And then these two blocks, once we know that the model is safe and the model is like working well in the real world, like a setup, and this is also like culturally and contextually like relevant, and it's also ethically like relevant as well. Then we should be looking at like what is the ultimate impact these models are creating. That's something that we see there is a massive gap in the literature. There's very little that is actually kind of looked into, like what's the final impact on the yield, or like say on like a farmer income and so on. There's one like a challenge, like even in the morning in Athena's like session on like benchmarking, we were talking about the ultimate impact is a distant goal. But AI is so fast that it can actually, the version 2 can come in like say 4 months. In 4 months, very little changes in agriculture. Yield may not change, like soil quality like may not change. But in impact, like what do we then look at? Like we should be looking at like at least like some of the intermediate outcomes, like so for example, let's say incidence of like pest, or like say the pesticide like a residue. Those are intermediate like steps, but that will be absolutely important for us to reach the ultimate goal. So once we know that these intermediate steps work, then we could be like relatively confident of like the final step. Like in one of our ongoing work in Andhra Pradesh, that's what our idea. We are actually looking at the intermediate outcome. In the second phase, we'll be looking at so what's the impact of the precision spraying that we are like promoting on the productivity and the like residue and so on. So just to summarize like all this. So the a donor or a government that is actually looking at like a funding or like scaling like AI should be looking at like 3 like things, like say, is it really like a safe to like implement that, there's an internal validity of the model, and then is it really working for the people who actually are intended to like use that, and then we should also be like sure of like what's the impact that it's creating.
Wow, thank you so much, Francis. So I do think, so what to measure, I think. Consensus on the what to measure in the context of AI is a good question for us to all ask and find a good answer to and align on and say, make it so simple, at least you're not having to go back and think about what this means, so not everybody has to figure it out in their worlds. I know we have very little time, but I'd like to take at least one or two burning questions from I'm not taking anything from the Athena team, I'm sorry. Yeah.
I'm Dr. Sailendra. I'm CEO of Agri-Gati. Agri-Gati we have deployed, we have prepared the model to use the DPI and UFI going to be from Government of India. And while doing that, I want to just share one example. Javier mentioned about extension worker ownership of the model, so that accountability is there, responsibility is there. Someone is there to just see what is the result. What happened, we are NRI, and we are taking care of our native place. And for our native place, native block we have selected. And in our native block, we have developed this Agri-Gati. And we have increased 4 to 8 time income of the farmers.
Oh, lovely.
4 to 8 times. We are just converting information into income, not only just knowledge. We have seen the agri stack of Government of India. It is static. We have built up the dynamic one, so that there is a soil master sensor, there is a coordinator, and it is delivering directly to pesticide to the farmers. And that dynamism should be there, because it is day-to-day operation. Market is there, market price is there. What we have faced the problem that the data at block level, district level from Government of India, that coordinate is not that much precise. Drone is going to somewhere else. And these things are there. And we make sure that our model is from bottom to bottom up, so that we have selected our native place, because we have to be accountable for our native place.
Okay, firstly, congratulations. I know I saw another hand go up, and can we just get a round of comments and questions, and then I'll come back.
Amazing discussion, and just to introduce myself, I'm a general manager and CTO of Qure.ai. We are an AI readiness company. We have already trained 10 million people across the globe, and we are creating the personalized AI role-based courses and certification. So one of the points that you have mentioned, and I would like to echo on that as well, I feel the mechanism which is missing is a reward mechanism. In India, Indian runs by heart. So, if you want to have an embedded AI, if you want to have an inclusive administration, if you want to have a proper framework, I feel that reward mechanism has to be driven by the government. So that
incentive.
Exactly, ma'am. Because see, in India, I think it's always, what's in it for me. So, if we can figure out that route, I feel we will get the last mile information from every single farmer you want. The reason everybody is on the WhatsApp, I tell you, we are seeing that there is a digital literacy problem. We have done a survey of more than 10 million people in India. We see everybody out of 10 million people, 98% people are using WhatsApp. So I feel that it's not about the ecosystem. It's about making the reward mechanism much more stronger. But the amazing panel it was, and topic was really touchy. Thank you so much.
Thank you so much. Gosh, quite a few hands. I'm only going to be able to take 2 more. I know he had his hand up before, and then you, and I apologize for that. I'm going to have to.
Yeah, Madam, this is Guru Raj Mahajan. I'm the coordinator for Smart Agriculture and Entrepreneurship Program in India for Tampere University, Finland. So we have been working with agricultural universities from past 14 years. So as you mentioned, we worked on participatory development. So my question to you is, you mentioned about this is an era of embedded AI devices which are happening. For example, one of the Pune-based company, they are looking for the soil testing. As the soil testing cannot take place across the India, so there are limited labs. My question to you is, what is the solution to we reach out to the final last mile farmers, madam? I mean, specifically final marginal farmers, madam.
I'll come back after that.
One more.
Yeah, thank you very much for giving me this last opportunity to interact with wonderful panel. Yeah, absolutely. So it's more of a question, or I would not like to bias this discussion by giving my introduction immediately, but I'll hold it for some time. But I can give you an experience that I have an experience of meeting or managing the inputs from 2.5 or 25 million farmers odd. Okay. Now my point is that I'm also a practitioner of AI and from UT Austin, so I keep working on the problems. I always believe that agri is very complex in India. Why don't we take lessons 5 years, 10 years back, which happened in banking and health sector? See, what happened was, when the AI got introduced, banking and health never went for solving everybody's problem on same day. We don't need to boil the ocean. We just need to pick up 2 clear-cut problems, maybe state-wise, maybe central-wise. Like look at banking. Thousands of problems, but they picked up only that, how do I manage my fraud system? They solved that top-notch, and then they created a web of solving the other problems. Similarly, healthcare. If I go back 10 years or 8 years back when the AI started building up before it coming to India, it was primarily how do I solve the breast cancer problem? Nothing else. And whole lot of exercise across the US and other part of the world, directly or discreetly, were focused only on collecting the information around the same. Nothing else, no else to be solved. And they just nailed it. That created an ecosystem, the environment, the confidence. So what I'm trying to say, can we portray that and bring out agriculture issue 1 or 2 and focus only on that? Thank you.
There's a data quality question, particularly Government of India. There is an incentive question, right? There is a question of, and maybe that's what we end with. What's that one burning thing we should solve for in agriculture? And then there is a question of feedback loop. Can we do rapid? Who can take? Can I give it? Yeah, maybe the incentive question.
Small part. So, yeah, just.
Each of you could, and also the burning question. What is that one problem that you think we should solve for, and then we can close?
I think it was discussed about the health and the finance sector. It is about creating the DPI, digital public infrastructure, which is like a pipeline which can be used for any different kind of purposes. So, and many use cases can be drawn to it. Where we are heading is creating a DPI structure, so which is based on trust, and you can use n number of cases over the years. Over to the next speaker.
Thank you. Very quickly, I just want to respond to your question. When I said like making the last mile workers part of the design team, I meant was they would be part of the trust building process in feeding into that, not making them as accountable, but like this human in the loop would actually having the last mile worker would really kind of help design and also help the workers like own this, and then would be able to like build the trust of the like farmers. And then in one of the ongoing work that we are thinking about, like involving last mile workers who would also be empowered to override the results or like the advisory of the like AI. And they would feed that information back for the next round, the model to like develop. So that's the human in the loop that would make the whole process more trustable and accountable.
I would answer your question about how to embed AI into the systems. So it is not impossible, but it is not that easy. We are doing it in different areas, like I said about finance. I also said about like your communication for WhatsApp. But agriculture is little diverse, and agriculture is very, very personal to the last ground. And the impact is huge, not only for the farmer, but even for the nation. It's a cascading effect. The crop loss converts into food loss, and then dollar loss, so on and so forth. So what I can say is right now that in order to make embed AI for agriculture, it should be the layers which need to be strengthened, and it should be a top-down approach. The problem definition should be bottom-up, but the framework should be top-down, wherein the government or the institution, the responsible institution like ICAR or maybe IIT Delhi who's working on that, so would just know that in which area, what is the problem, who are all the stakeholders, just connect them, make a small nugget of all the information which is coming up, and then create layers, empower each and every layer, and there could be a feedback loop which is created. So that is the only way we can have backward and forward talking of the information which is moving, and that actually embeds. First, it will embed in the pipeline, and then it will embed on the device.
Thanks for that discussion. And one last, as Deepa said, one final thought before we close. I think inclusivity is definitely one thing that would be a key takeaway for me. As we talked about having a sweet spot between, context specific, but also, intersection of policy and practice. I think participatory designs more as opposed to hand-me-down approaches would definitely be a key takeaway here.
Fantastic.
So yeah, that's
Thank
it.
you so
Thanks.
much. A huge round of applause for the fantastic. Maybe if we met a year from now and did the systematic review again, we'd see very different results. In anticipation of that, thank you all for being a wonderful audience and for being here with us, and hope you enjoy the rest of the conference. Thank you very much. Okay, and do the audience have to stay for that? Go have lunch.
Now we have done the POC. Pilot work कर रहा है. This is like before the exam, we have released the question. Just one question. Yes. Sorry? This is the PPT. So folks, I'm going to reset it. Thank you. Yeah, please. I'll reset it now. But you can retain that that page. It's going to come back again now. There are 5 questions for you. So here is a quiz. Yeah, this is all AI quiz. Sandstorm, Stanley, and Boss. Sandstorm, Stanley, and Boss. They participated in some event which eventually led to the creation of an entire industry. By the way, Sandstorm failed the first time. Stanley aced it the next year, and Boss pipped to first place the year after, a few years later. What are we talking about? Show of hands. It's AI question. Sandstorm, Stanley, and Boss. They participated in an event which eventually led to the creation of an entire industry. Show of hands. Anybody? Guesses? Guessing is allowed, yes. Sorry? Did they succeed? In succeeding what they wanted to achieve? No, are you asking me a question or telling me something? Yes, it's, yeah. No idea, any guesses? Guessing is allowed. Artificial music creation? No. But it's some artificial something. Can we have the question? Yes. Stanley, Sandstorm, Stanley, and Boss, they participated in some event which eventually led to the creation of an entire industry. You know, if I give you the next clue, I think you will crack it. Huh? So this event was taking place in the middle of a desert. Yes, 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 there you go. What's your name? Huh? Anuj. So this is the DARPA challenge which led to the creation of the autonomous vehicle. And Stanley, Sandstorm, and Boss were the names of the autonomous vehicles. So this is 2004, the Mojave Desert, $1 million grand challenge that DARPA had announced. And which were the two universities that were involved? CMU and, yeah, we got the other one, Stanford, yes. That's true. So Waymo has come out of this. Waymo has come out of this. Are you in the mood for one more question? I mean, I really don't care what answer you give. I'm just kidding. Yeah, shall we go for another one? Some energy? I hope you've had some lunch. I mean, what I can promise is, of course, the panelists are going to give you nice food for thought. That much is there. Okay, so the Diamond Age, a science fiction novel by the American writer Neil Stephenson, was published in 1995. Okay, so the Diamond Age was a science fiction novel by Stephenson, was published in 1995. And so the most powerful piece of, something, the main character, if you will, wasn't a spaceship or a weapon, but it was a book. The book was called A Young Lady's Illustrated Primer. Yeah, in that book. In that book, the protagonist was a book. The book was called A Young Lady's Illustrated Primer. And this was a source of inspiration for someone who created an edutech company in 2022-23. What are we talking about here? Who is this person? And there's one person here who can't answer this question though. Except that person, others are allowed to answer. Swati, I'm referring to you. You can't answer this question. Oh, you didn't hear the question. Okay, good. Khan Academy is not the right answer though. That's not the answer. Huh? What's the question? The question is, Diamond Age was a science fiction novel whose main character was a book called The Young Lady's Illustrated Primer. Now that book became a source of inspiration for someone who created an edutech company in 2022. Khan Academy was not in 2022. But let's just say you're getting warm. Come on, if you say Khan Academy, what's next? No? Khan Migo. So it's Sal Khan, and this was the inspiration for Khan Migo. For more on this, of course, Swati will be on the panel and she will share some. So folks, how are we doing on time? We are getting there? Yes, Shaveta is also here. Fantastic. Okay, we will close this off with one final question. Yes. Okay, this is a good one. Arthur Samuel. Arthur Samuel was a pioneering American computer scientist, IBM, Stanford University. In the early days of computer programming, if, for example, games were coded. So if programmers wrote a game, they would essentially code in a large number of if-then rules. That's how they used to build the games. But Arthur Samuel did something different. And in 1959, he wrote a game to play checkers. And in writing about it, he coined a new phrase, which has become very popular. Let's just say the understatement. It's become very popular these days. Huh? Which one? Functions. No. It's a very popular. You can't, I mean, you come to an AI conference and if you yes. Machine learning, yes. That's right. So he coined the phrase machine learning. But what did he do? Anybody, what did he do? So you know where machine learning comes from. So so by the way, if you want more such stories, another panelist on, another of our panelists, Anil Ananthaswamy, has written many stories in his book, and you can read his book and so on. So I'm just setting up the panelists this way. We're done? Okay, fantastic. I think we are ready to. Okay. I'd love for the speakers to come and be seated on the stage now. Swati, Shweta, Anil. Where is Sunil? Oh, on a call. Okay. Yes.
This is for a photo op. I request all of you to be on the stage. Come to the center. No, can you stand, please? Good to go. Ladies and gentlemen, a very warm welcome to you all on behalf of the Vadhwani School of Data Science and AI and the Center for Responsible AI at IIT Madras. It's an honor to be representing IIT Madras at the Impact Summit 2026. Before we begin, I'd like to give a quick introduction about the Center for Responsible AI and the work that we do in case some of you might not be aware of what we do. The Center for Responsible AI at IIT Madras is a multidisciplinary non-profit research center positioned in the global majority. We are among a few global institutions that specializes in both technical and policy research to ensure and enable responsible development and deployment of AI systems. The center aims to pursue research in ethical and responsible AI and become the standard body in the country to recommend guidelines and policies to make deployable AI models and systems more accountable, explainable, and responsible. Through its work, CRI, which is Center for Responsible AI, brings together researchers, policymakers, industry leaders, and civil society to build AI systems that are not only innovative, but also trustworthy and aligned with societal needs. Today's panel discussion is a reflection of that, and it's my pleasure to introduce our moderator, Mr. Krishnan Narayanan, who's the co-founder and president of Itihasa Research and Digital. Over to you, sir.
Thank you, Srivatsan. And of course, I'm very delighted that we have an outstanding panel with us today. In fact, I was thinking, so for example, Swati is the country director for Khan Academy, India. She brings the school, the school perspective in this conversation today. Shweta Sharma Kukreja, is the managing director of CSF, Central Square Foundation, and she brings in a perspective of taking these solutions to the market and how that implementation happens. Srini Parthasarathy, he is a professor at Ohio State University, and he brings in the higher education perspective into the mix. Anil Anathaswamy is a professor of practice at IIT Madras. He's authored multiple books, one of which is Why Machines Learn. And so he will bring in the perspective of the technology behind safe AI and so on. And finally, we have Sunil Wadhwani, founder of Wadhwani AI, businessman, investor, philanthropist. So he's going to bring in that perspective into this conversation. Yeah. So we have a fantastic panel. It was going to be like a thali for you. Yeah, nice. Some 5 things. Hopefully, I have requested them to keep the answers short and sweet. We also have lots of engagement with the panel. Yes. About Sira is done. Oh, this is the... Right. So before we get started, I just wanted to set a context. Now, this is over the last 4 years, this is my perspective on safe AI. Yeah, so over the last 4 years, I've been researching this topic called co-intelligence. We can keep the mobile phones on silent, please. So we've been researching co-intelligence along with Professor Venkat Ramaswamy from the Ross School of Business and Keranjam Ozan, who's a philosopher. And we have identified sort of 6 layers of a co-intelligent systems architecture. Yeah, so on the left-hand side, the first 3 layers are more infrastructural, if you will. So things like data, the models, what we call as machinic cognition, the agentic systems. Yeah, they all kind of, the infrastructural aspect cover the first 3 layers. But that alone is not sufficient, is what we argue, that in co-intelligence systems, you need to have the next 3 layers, which are what I call as phenomenological layers. Yeah, so the layer 4 is where the humans and AI interact with one another. Layer 5 is life experiences. So in the case of education systems, it has to take into account life experiences of the students, the teachers, the administrators, and so on. And finally, the sort of the ecosystem view, that what learns in one school, how can the entire state sort of understand from it, and so on. So my simple statement is whenever I think of safety, I think of safety across all 6 layers of this education coin system. Yeah, that's how I'm going to be framing and thinking about it as our panelists speak. Okay, so I'll first start off with Swati. Khanmigo, which is now a learning assistant used by millions of students. What does safe by design look like?
Thank you for that question, and thank you so much for having us. And what a great group of diverse set of perspectives in this panel. So really excited to have this chat on such an important topic. You're exactly right. Khanmigo is today being used at a very large scale with about 44 lakh or more than 4 million students, and 14 lakh students, no, I said that wrong. That's 40 lakh students and 14 lakh teachers across the world that are using Khanmigo, and out of which 2 lakh students and 2 lakh teachers are in India alone. So very large scale deployment already. And we do believe very strongly that any AI tool has to be very thoughtfully designed with the learner at the center of it, and responsibly tested to ensure safety, security, and privacy of the learner and everybody else that's involved in interacting with the tool. And Khanmigo, like you said, is built with a lot of those safeguards in it. For example, first, Khanmigo sits on top of Khan Academy EdTech platform, which has world-class content in it, which is being properly quality checked, ratified, and aligned to state curriculum board. So it's pulling content from high quality, well-known set of library, and not just from anywhere, from any unratified, unqualified, content source. That's number one. Number two, it's also, because the Khan Academy platform does not capture any personally identifiable information about the student, so Khanmigo does not have access to that information either. So that's another very important safeguard that's built in from the get-go. And third, Khanmigo does have the ability to, it in fact logs all the interaction that the student has with Khanmigo and uses that information to identify any potential risky situations or potential risky interactions for the student and unsafe potential situations and flags it to the teacher. So that's kind of how the tool has been designed with all of these things in mind. But more importantly, I would say we are deploying Khanmigo today at a large scale in India in a teacher-directed manner. So it's got human control and supervision that's at the, not just at the center of it, but it's leading the deployment of Khanmigo. And so I think that adds another layer. And the moment you bring in a tool, AI tool, in an integrated fashion with existing systems and not as a separate thing that's sitting on the side, unsupervised, uncontrolled, then that jury that's out on AI being safe or risky, I think that starts to tilt very heavily towards the benefit side of AI. So to me, in a nutshell, what I'm trying to say is that it's not, design for safety is not just about designing the tool, the development of the tool, but it's, in fact, I would argue more about the deployment of the tool and the implementation, making it human-directed, making sure that it's supervised and controlled by human beings, and we're doing that. We're scaling it in a very, very thoughtful manner, step by step, capturing learnings at a small pilot level, what's working, what's not working, what makes it safe, and investing in that capacity development, and only then taking it to scale.
Right. No, in fact, I have read about the Socratic way in which the things are taught to the students and so on. So it's fantastic. In the India pilots, Swati, were there any safety constraints which were different than in the US, or were they similar in India?
Yeah, so I think, students are similar everywhere in terms of the risks attached to education learning process. We have to be mindful of similar things across the board, and I'll give you an example. In one of the Latin American countries where Khanmigo is being used, Khanmigo was able to identify a particular specific situation where the student was at potential for harm, self-harm. And it got identified by Khanmigo, it got flagged to the teacher, and the potentially very harmful situation was avoided. So that is a very good example, which is a developing country as well. In India, similarly, we are not having to do anything that different from how it's being done in the US. The guardrails work equally well everywhere, and they must.
Right.
Just because you're a developed nation or a developing nation, it doesn't matter.
Right.
Children need as much safety everywhere. That's kind of our philosophy.
Right.
And you're right, the Socratic method is used everywhere.
Right.
Which is why even for B2C, where the children are using it on their own and it's not teacher-directed, how do you ensure safety for those children, not just in terms of social emotional wellness and safety, but also learning safety, so that you're not messing with their minds and making them dumber? How do you ensure that? And that's where Socratic nature comes in.
Correct.
So it doesn't give you the answer, it leads you to the answer. And that's across the board.
Okay, good. Okay, so now we will go to the audience question. I'm going to reset this slide. Okay, I'm going to request you to now access this. It should have come up on your screen. So what is the biggest safety risk of AI in education right now? There are 5 choices. Don't be shy. I encourage more of you to participate. In fact, we did discuss as a panel, and we really want to understand what the audience is thinking here. So the more of you participate, that'll be wonderful. So don't shut this thing. Just keep it on, because the next question, when it comes, will automatically get refreshed on your phones. Yes. Right. Right now, I have forced you to choose one. Your topmost one. All of them. All of the above. See, that's why we didn't choose all of the above or none of the above. Okay. Great. So about 70% seem to think student dependency, reduced thinking seems to be the biggest risk right now. Okay. So Srini, I come to you next. So, this can remain here, or maybe you'll get tempted to keep filling in the answers. So this is done now. We are just moving forward. But this is going to be the next question. Okay, let it be there. Okay. So Srini, I'm coming to you. So that we get Swati gave a school perspective. We'll get a higher education perspective from you. So in higher education, sort of AI touches many aspects: writing, grading, admission support, research workflows, etc. So what does safe AI mean to you?
I think it's a very important question. I come from Ohio State University, where we just announced what I think is one of the first AI fluency programs, which basically by the time a student graduates from the university, they would have touched AI in some part of their curriculum, regardless of which part or discipline they come from. So we're talking, 60,000 students across over 100 disciplines that the university covers. And so safety is a paramount, in terms of the implementation, safety is a paramount question in this context. Let me give you a couple of examples where these things sort of provide major challenges. I mean, think about the current role in admissions. How do you admit a student into the program right now? So students are increasingly using AI to write down their statements of purposes, their CVs. Professors who write recommendations for them are increasingly using LLM technologies. So it's hard to sort of really understand, what the individual is doing. On the other side of the boat, counselors are using AI to filter candidates. And so we are really, what we're moving towards, and this scares me no end, what we're moving towards is essentially using AI to evaluate someone else's use of AI, as opposed to the individual. I mean, this is, as you can imagine, this is a problem. Now, of course, when we talk about in the classroom, safe use of AI, we absolutely have to embrace it, because AI can democratize access. And I think that's really important. There's a real win here. But we have to do this with careful guardrails. Now, what does that mean as a professor? I used to love open book exams, because I didn't want to disadvantage people who did not have the best memorization skills. They could actually understand the concept, work with things, and do that. But now the danger is, if I have to set an open book exam, I have to run these questions through 5 different frontier models, hope none of them capture it, and only then can I vet it and actually provide it. And even then, there's no guarantee, because what I set, last semester, frontier models are advancing so fast on some of these things that, by next semester, they would have solved that. So I have to come up with new clues. But okay, that is something I'm willing to do. But the real concern, and this is related to this question, my position on this question is the biggest harm that I worry about with, introducing too much AI into the classroom. When I was a student, I learned not only from my teachers, not only from my books, but from peer interactions. today's peer interactions is ask Claude, ask Gemini. And I'm worried about the cognitive decline and the mental health aspects of that. And we've seen this. We've had like more than 2 decades of social media where everybody is on this, Instagram, that, Facebook, whatever, okay? And so you are seeing, we are now at a point where we can measure some of these things. And so that is a critical harm. You touched on research. Just one point on research. There was a recent paper in Nature, 2 days ago, I believe, which pointed out that the use of LLM technologies seems to be helping people, at least in terms of getting NIH grants. NIH is the National Institutes of Health. It's one of the largest funding bodies in the United States for health-related applications. But one of the comments that came out of this, which concerned me, and it's kind of ironic in a way, is that a lot of the ideas that are coming through are kind of safe bets. They're not the high risk, high reward, which you want in research. And that's a challenge and a potential harm as well.
Right. I mean, I relate to this. I conduct a college level hackathon in India for Global Learning Council. Last year when we did it, we were all judging various LLM answers. So this year we said absolutely no responses in English from the students. Just give us the model that you built and we'll evaluate you. Yeah. But okay. Now, Srini, you've developed tool for online fairness auditing of AI systems. Yeah, AWAR is a tool that you have built. What does AWAR in the context of an AI system in education? What will it mean?
Yeah, again, when you think about auditing or evaluating, we're trying to monitor things that are, as I think Shweta pointed out, things that are deployed, okay? And so the deployment, it depends on who you're deploying it to. So for example, I said, OSU is going through this AI fluency effort where you're training the next generation of a medical doctor. You're also training the next generation welding engineer. You're also training the next generation historian or literature student. When you say auditing, it depends on context. Another point that she made in the context of Khan Academy. So context matters here, who you are auditing. And again, the other point, and very related to her answer as well, is there's a human in the loop, the learner, the teacher. So there are humans in the loop. So when you audit a system, or when you audit learning outcomes and things like that, you are auditing the entire process. It's not just the machine learning model that's being used or the AI model that's being used. This is a hard question. Now, for some things, we have reasonable approaches, regulatory approaches, or part of the fiber of a university or a college or an institute. We have, where data must be protected, okay? There must be privacy. One must ensure that data is not released through this interaction with an LLM system. So we have reasonable definitions on that. But and even for fairness as it relates to regulatory fairness. But where things become really challenging and amorphous is that safety is, when you look at something, yeah, that's safe, that's not safe, this is unsafe, borderline safe. When you look at something, you can say it, but it's very hard to determine these specifications a priori for safety. And that's what makes this problem really challenging, so to speak, in the education. But we're trying to figure it out. As I said, we announced this. This is going into sort of our curriculum, and pretty much every student who graduates by 2030 will have sort of this AI fluency effort as part of their degree at Ohio State. And so we've got to figure this out fast.
Yes, you've got to figure it out. Okay, so time for the next audience question. If forced to choose, what should educational institutions prioritize first? So I'm going to start this. I mean, panelists too can participate. Okay. This seems sort of balanced, or this is the other thing. I use this in a class that I teach at IIT Madras. I always have hundreds of people who show this sad face emoji. And then I usually have some friends who take over and then put that 100 plus happy face emojis. So, okay. So I think it's sort of settling in now. Good responses. Learning gains is sorry? How are we? How are we ensuring? It's in the poll. Only one person can answer. I mean, only one answer per person. Yeah. Huh? Per phone. Per phone, yes. Of course, if you have many phones. Professor Ravi, he knows all the tricks of the trade here. Okay, but so learning gain seems to be the topmost, but student safety and well-being also is like, yeah, so it seems like a good, okay, good. So next we will move to Anil. Anil, in Why Machines Learn, you sort of explained the math behind the AI systems. So put on that math cap. If a school system now claims an AI tutor is safe, what evidence would you want to see before accepting it, before it scales?
I'm not sure there's a math answer to that. I think for me, if I'm thinking about these systems being deployed in schools, I would want to see some evidence of a framework that addresses multiple issues. One obviously would be whether these systems are fair and unbiased, right? For instance, if we are using AI systems to tailor the educational content that is being delivered to students, and maybe these systems are trained on native English speakers, and you certainly have, especially in the context of India, we have people who might be speaking heavily accented English, and somehow these systems determine that someone speaking with an accented English is probably less capable in terms of their educational qualifications, and ends up being fed material that is probably less intense than somebody else who might be speaking fluent English. So those kinds of lot of issues that need to be worked out as to how content is being delivered and how students are being guided in the trajectories they take through their educational journey. So a framework that, so in terms of seeing, in terms of wanting evidence about how this is being deployed, some framework that is addressing this. Also, potentially looking for whether these systems have humans in the loop. I really would like to see teachers having the ability to override certain decisions that the AIs might make. So again, are these systems in place? Also, before going...
But can I just push back a little bit on that?
Sure.
So one of the arguments for human in the loop has been, hey, there must be a teacher.
Mm-hmm.
But then there are others who argue, look, hey, the child wants to understand, at 10 in the night, the teacher is not available. So you must make this system available to the student on their own. How would you, the teacher in the loop is not available now.
Fair point. And but I think there must be some way for the educational institute, which might be an individual teacher, a bunch of teachers, doesn't matter, some humans who are able to audit the trajectory itself that is being pursued by a student. It doesn't have to be at the granularity of looking at it every night, but somewhere along the line you need a human in the loop.
Sure.
The other
That's a
thing
good
before
point, yeah.
scaling would be that before you deploy it, let's say if you're taking an Indian state with, tens of thousands of schools, instead of doing it across the board, actually testing this out in a few local schools somewhere,
right,
making sure that these things work. So a framework that addresses these issues, I would like to see those things in place.
Sure, sure. Okay, so here's the tough question for you. If an AI tool causes harm in a school as in it could be in the form of some misguides learning or undermines the agency of students and things like that, who should be held accountable?
So we all had this discussion offline before, and my answer to this was that I think responsibility in terms of safety of AI systems cuts across the board. It begins with people who are curating the data for training AI systems, because we know well enough by now that a lot of issues of bias and fairness arise from the quality of data. Then there are responsibilities that lie with the algorithms, the people who are choosing the algorithm. There's algorithmic fairness and bias. So out there too, there's responsibility to do with the model developers. And again, when we think of AI these days, most of us just think of LLMs, but that's not it. There's a whole bunch of other AI models. So, understanding what are the inherent biases and capabilities of individual models and being able to pinpoint where these problems might be arising from. So there's, responsibility at that level. The deployers of these systems are again, have some onus upon them to make sure that what they're deploying is safe. End users too. So I really think it cuts across the board. And yes, it's a kind of a argument that goes nowhere when we point fingers at everybody. But the other way to think about it is these are such complex systems that we are developing that I think by making sure that everybody feels the onus of responsibility, we at least start from the ground up by building things that are fair and responsible.
I mean, on a lighter note, Anil, like you, is all of the above guy. But it's a serious point that you say. I just want each one of the other panelists, just one word, not a long answer, but what do you think? What's your answer to this? Who should be held accountable? If an AI tool causes harm in a school, who should be held accountable?
So I kind of agree with what Anil said. It is a shared responsibility. But I think what you mean is who should be liable.
Okay.
Okay. So accountable, I think all. Okay. Definitely true. But I think liability, it is a function of individual cases. It's not a one-size-fits-all solution.
It depends.
Yeah.
Okay.
Yeah.
Great.
Good point.
So I'll be more direct. I think the system that approves its deployment at scale will have to be held liable and accountable.
Which is?
I mean, typically, if you're scaling up,
Is that school? Is that a school or?
So typically, at least in the government system, an individual school will not make the decision.
Will not make it. Okay.
The state will typically make the decision.
Okay.
If I am an independent school, then the school owner or the leader is making the decision.
Okay.
But while everyone is accountable, the liability is with the person who approves the deployment at scale.
Sure.
At that unit.
Sure. And Swati?
I'll do a +1 to what Shavata just said, because to me, the accountability, yes, responsibility is for everybody, but the accountability really lies on the ones who are strategizing and designing the deployment. And for a simple reason that, and I'm not absolving the ones who are developing the tool completely of it, because yes, they have to exercise their responsibility, but we also have to recognize that you cannot make 100% safe and accurate AI tool. You just cannot. So what you have to do is ensure there are checks and balances while you're deploying it. So the deployment person, the onus is on them to ensure that there are checks and balances taken into account while designing the deployment process.
Right. Okay. So audience question. Would you accept an AI tutor that is 5% wrong? Okay, that is wrong 5% of the time, but it helps reach 10x more children. So Axis, it's doing great work, but it's 5% of the time wrong. Would you accept? Yeah, it could hallucinate. You are absolutely right. When you question it, it will give the exact opposite answer, and it'll say you're absolutely right. By the way, I love this crowd. Net, we are positive on the positive things here. Thank you. No, I'm saying the smiles. See, I am looking at the real metrics that matter to me. Okay, so it's settling down, yes, but only with the teacher. So human in the loop. The human in the loop seems to be the winning. Yes. Okay, great. Okay, fantastic. So now we move to Shweta. What does SAFE mean for the global south, for the students, the teacher systems from the low-income communities? What does it mean?
No, before I answer, I was introduced as I bring the perspective of the system. When Professor Srini was talking, I also bring the perspective of a parent to two students in high school who understand AI definitely better than the mother does. In most cases, better than the teachers and the counselors does. I'm hoping not better than the admission officers, but it's a lived reality. And also conscious of saying it in the AI summit, but to keep things simple, the more things change, the more they remain the same. And I want to go back to the basic of safety in the global south for AI. And why just global south? I would say also for the global north. Goes back to how any education intervention will be considered safe. When all design and governance choices do not lose sight of what the pedagogy is, what the curriculum expects to be covered, what are good instructional practices. So at the center of AI adoption has to be these criteria on human role and judgment, instructional practices, pedagogy, and curriculum. For a student, it means it has to be age appropriate, it has to be curriculum appropriate, content appropriate. A lot of AI engagement is happening for students without them realizing it. I think it took us a long while for many of us as adults to realize when we are engaging with AI chatbots versus a live customer service agent. Imagine what it's doing to our children. So it has to be age appropriate and centered around sound instructional practices. That's what SAFE looks in for a student perspective. From a teacher perspective, it has to be transparent and assistive. Anytime if we dare to imagine a world where AI is being looked as a substitute, is where we run into it being unsafe, both from a design perspective, governance perspective, adoption perspective. To your prior question on who is accountable, who's responsible, who's liable. At the end of the day, any solution needs to be integrated into how the education system runs its schools, teaches its students, what's the role of the teachers, how is their capacity being built, how are they being supported, how are they also being held accountable. So a system which gets anchored on pedagogy, on relevant instructional practices, with human judgment and adoption at the center, age and grade appropriate for students, assistive and transparent for teachers.
Fantastic. But I want to just push back a little bit. I mean, both you and Swati sort of seem to indicate, and maybe I'm getting this wrong, which is like, hey, safety is more or less the same whether it's global north or global south.
Yes.
It's the same, yeah. But the context seems to be very different in global south. The access issues and so on. So I'm just asking, can it be the same or whatever? There is no right or wrong answer, but I just want to.
I'll tell you from my perspective, right? Access is a different dimension that we're talking of. How many children access AI in global north versus global south? The quantum of students can change.
Right.
Now, whether in the global north, 100 students are accessing, and in the global south, 5 are accessing. Why should safety norms be different? To me, the axis of safety doesn't override the axis of access and vice versa.
Right.
At least that's how I look at it. But Swati, you want to add?
Yeah, no, actually completely agree with what Shravata said. And I think what you might be looking for, which again is more on the access side and less on the safety side, is the ability of the student to be able to actually benefit from the AI and interact with it comfortably by making it in their own language, making it easier to interact with because the content that it's pulling is also in vernacular, the interaction is in vernacular. I think those are some of the things that you might be thinking about. But to me, that's again more
But
on access side. Yeah.
I'll tell you one perspective. Like in my company, we have run some, sort of digital society surveys. Now, one of the things that we find different in India is a trust in the government systems. And the reason, one of the hypotheses we gave was because the literacy levels in digital is lesser in India, they generally depend on an external system for approval and so on. And so, given that the literacy levels among children here are lower, perhaps even among the teachers are lower, I'm just pushing this out, saying, so in the global north, you might say, hey, teacher can take responsibility. But I might go around and say, even in India, even teachers may not be aware. So maybe there is greater thing in terms of putting in the system itself some guardrails, for example, which may be different.
Very fair point. And in fact, I have an example to illustrate exactly your point and add to that. You're right. In the overall learning journey, there are more stakeholders involved in India that need more awareness building and capacity building, including parents. And the process of doing that is very different. Because in the US, if you don't do that capacity building and awareness building for the parents, you can still get away with a little bit of that. And I know I'm going on a limb here to say that out loud. But in India, you cannot afford to do that. For example, the devices are shared in India in the government school system. So the students do not get adequate time on a device to be able to access an AI tool and work on it. So what we need is a seamless integration of classroom and at home. And the moment you talk about at home, again, to make it safe, it needs to be supervised. And who's going to supervise it? A parent. And most of these parents for the underserved students, government school students in India are semi-literate to illiterate. So how do you ensure safety over there when they, get past that school boundary and get into the homes? So I think that's where you're exactly right. That point does come in, and we've had to take extra precaution of doing B to G to C, utilizing the teachers and equipping them with all the tools and communication collaterals, etc., for them to be able to have that conversation with the parents in the parent-teacher meeting to make the parents aware so that they have some mechanism to apply that supervision even though they're illiterate. For example, आप सिर्फ logo देख लेना, अगर आपको logo नजर आ रहा है बच्चे के phone पे तो बच्चा is okay, right? We've literally had to do that.
In fact, Shravita, that's a great segue for the question to you next. Through AI Samarth initiative that you and IIT Madras and others are driving. I mean, we are working on AI literacy for school children and teachers. Yeah. So tell us a little bit about that and why this is important. I mean, we have already set the context, but hit it for a 6 now.
I think it goes back to we are taking the initial steps to the vision of, again, I'm going back to when Professor Srini was talking about AI fluency. Again, I'm repeating myself, but we live in a digital country. We are in a country that's proud to be a digital powerhouse. We're talking about, teachers and students on an average are more literate in the global north versus global south, but we are a digital first country. In many ways ahead of the so-called global north, right? Now, in this context, whether or not we realize it, AI is governing my search history. Even for a student, even for a teacher. It's showing up recommendations, it's giving up unsolicited answers. Not everything follows the Socratic method. It is, of course, not sharing with me what percentage of error I am. Is there a human in the loop or is there a tool in the loop? In this world, for us, the very first step towards this vision of AI for all is, does everyone, every student, every teacher and parent understand what is AI? How is it already beginning to engage in my education journey? And based on the two, how can I become an active user of AI? Whether or not we like it, AI is shaping any child who's spending time on a device for learning. As a 2024 showed, 82% of children in the 14 to 16 years of age group use smartphones for learning. CSF conducted a Bharat EdTech survey in 2023. Upwards of 3/4 children are spending more than 30 minutes on their device. Now, the moment we look at these two figures, right, we know that that percent of children is interfacing with AI without realizing it. How do we move them from passive users to actually having agency, making informed, safe, and responsible decisions? And that is really the attempt with AI, Samarth. Proud of the work that's already happening in close collaboration with IIT Madras. As of last month, already 1 million students and teachers across 10 states in India have started engaging on AI literacy. And the vision is for that to build on to the levels of AI fluency. And when the human in the loop is actually an empowered, aware, and active user, rather than, I don't know what's taking over my life.
Right. No, so kudos on the 1 million, one small cheer. Okay, so the next question to the audience. Should schools keep logs of student AI conversations, for safety and audits, of course, but should they keep logs of student AI conversations? What do you think? I mean, Srini does have a good point. He says, look, we can have logs, but really who has access to the logs? That's the important question. Good, Srini, you're not grading my questions.
No, Ravi's doing great job.
Okay, it's okay, it's settling in here. Yes, but anonymized and minimized. We did have a discussion. You see, the thing with logs, of course, it helps in making more personalized learning and so on. So there is some way. For example, teachers also have access to it, so they can come back. That's on one side. But on the other side, there are issues about students having a safe space to answer questions, mental health issues and things like that. But really, who has access to this? That's the critical question. Okay, Sunil, we come to you next. Put on the philanthropic funder hat. How do you decide whether an AI in education idea is worth funding, scaling?
Sure. Before I answer that question, let me just respond to the conversation that's been happening. Forgive me. So just for context, my own background is a little bit tech-based. I went to IIT, then I went to the US, went to Carnegie Mellon, got a master's degree, and I've started a few technology companies. First company failed, other companies did a little better. One thing I learned very early on is that there is nothing in the world, there is no solution in the world, tech or AI, that is perfect, right? Everything involves a trade-off. My first company was a medical device company. But these things didn't work, patients got harmed. But did it work 100% of the time? Probably not. But overall, the benefits outweighed the risks. Automobiles are a great example, right? We all use cars, we don't think about it. They kill 1 million people a year plus around the world. Yet society has made a choice that it's worthwhile. The benefits outweigh the risks. when we come to AI, we have to keep that perspective in mind. And my concern in discussions like this is we tilt too far one way or the other. So let's look at the social sector, right? We've got over 8 billion people in the world. 3.5 to 4 billion people do not have access to decent healthcare, do not have access to decent education. AI could be transformative today. It is starting to become transformative today. Yet, are these systems 100% perfect? No. Do the benefits greatly outweigh the risks? Yes. So I'll give you a practical example. So I started 6-7 years ago in India an artificial intelligence foundation, and Prime Minister Modi ji came, inaugurated, blah, blah, blah. I've got about 400 full-time people in this foundation in Bombay, Delhi, Bangalore. We've developed over 25 AI platforms that are now scaling up nationally. Many of them are becoming national platforms. As part of this, about 18 months ago, we got a call from the government of Gujarat. My team went in. They said we have a large problem with the very high school dropout rate that we have in early grades, grades 1 through 5, especially among young girls. Do you think AI can help? We did the analysis. And we learned that the primary reason for this, and of course, once you drop out of school, it affects the rest of your life. It affects the earnings you make, it affects the health that you have, it affects your skills. And especially when it happens to young girls, it affects not only them, but their families. So we did the analysis on why is there this high, and by the way, this high dropout rate is not just Gujarat, it's around India, and it's the entire global south. The single biggest reason, it turns out, for this high dropout rate is the inability of these young children to read proficiently in their mother tongue. So in this case, this was Gujarat. And 50 to 60% of the children in grade 5 couldn't read in Gujarati effectively, even at the second grade level. When you can't read, it affects how you do in every subject: geography, science, history, literature. And if you struggle in every subject, you say, why am I doing this? And in low-income families, your parents say, okay, come home, start working, etc. So we've come up with a suite of AI solutions that basically we do an assessment in 20 seconds for each child. We figure out what's their reading proficiency level, where exactly are they struggling, on what words, what are the patterns, etc. Based on that, we come up with a diagnostic. Based on that, we come up with a remediation plan. We divide each class into cohorts of people with similar issues, and we guide the teacher and the parents on how to address this. The results that we started getting in the pilot were impressive enough that about 6-7 months ago, the Gujarat government made it mandatory. All 3 million children in government schools in Gujarat are getting assessed and remediated with the tools that we have. Thank you. Then Rajasthan saw this, and about 3 months ago, we became mandatory in all the schools in Rajasthan. Now it's spreading into 10 states, and if all goes well, by the end of next year, 2027, 75 million children in India will be improving their reading proficiency thanks to the suite. And again, I'm not bragging about what we've done. Any other competent AI team could have developed any of this. Here's the point I'm leading up to. Would these systems pass all these AI audits and frameworks and all? Probably not. I don't know. Should we wait 5 years or 10 years to have the perfect system? And in the meantime, 30 million or 50 million kids in the global south don't get educated? So the only point I'm trying to make is it's good. We need safety, obviously, in AI systems. We need lack of bias, obviously. But we have to keep in mind, again, that we have to make an intelligent choice. And are the benefits strong enough to outweigh the risks? We have to manage the risks, but we push ahead. Sorry, that was a digression. To come back to your question, how do we select what AI issues to work on? Whether it's healthcare or education or agriculture, we work in all these domains. We take a look at, number one, is it an issue of importance to the government? So whether it's the national government or the state government, is this one of their top 3 or 4 priorities over the next 3 or 4 years? So as an example, in health, we work very closely with the health ministry in Delhi and with about 12, 15 states. They told us 2 or 3 years ago, tuberculosis is a huge issue. It's probably the number 1 or number 2 priority in India, and in fact, much of the global south. Close to 2 million people every year die of TB. So we've developed a whole suite of TB solutions that are now being used by the Central TB Division. In education, this oral reading fluency is expanding dramatically. So again, number 1, we look at how important is it for government. The reason we do that is the only way systems scale when you're talking about disadvantaged communities is by working with government. So you talk to them right from the beginning. The second thing we look at is this actually appropriate for AI? Do we have the right kind of data, or can we collect the right kind of data so you can train your models on good data? And that is where safety and bias and all of that comes in. Thirdly, before we start building any AI system, we ask this very important question: how will it scale? And we've learned the hard way, it's complex. When you're talking about giant government systems, so let's say in education, you're talking about working at the last mile with teachers, you're talking about working with state governments on execution, you're talking about the central government on policy. How will this get out to the last mile? It's not easy. And that is the single biggest reason why 98% of all the wonderful AI solutions that have been developed for the social sector don't scale. They go nowhere. They may be totally safe, they may be unbiased, but they don't improve people's lives.
Right.
So right up front, we work with government, we'll talk to the joint secretaries in Delhi, we'll talk to the heads of the national health missions at the state level. How are we going to train the frontline health workers or teachers or farmers to use the system? Where will that data go? How do we manage it at the state level, et cetera? So we look at that. Absolutely, we look at safety and bias. And then there's a feedback loop as you go through all.
Right. Good. Srini, you had a point to make?
No, I was in complete agreement. I think that's the reason Ohio State's embarking on this AI fluency. It's a total embracing of the AI and the fact that it's here to stay, and it's really, really important for democratizing access. And your example in Gujarat, which I had read about, is really a valuable learning experience in terms of the kinds of things AI can bring to the table. I think the key challenge for us in terms of implementation is that we have to work with our state government and our federal laws and things like that to make sure that whatever we are doing, because like for example the holy grail of related to this question that you asked, all student logs are kept, but access to those are incredibly protected, and they can be really useful for student learning outcomes and things like that. Right. So I think, 100% agree with the point you made, Sunil.
Right. Okay, excellent. We'll go to the next audience question, the last one. Since we were talking about this,
See, that was
parent, yes. It's, we'll wait for a few more minutes for the thing to settle. Time is up. Yes. Yeah. Okay, so what we were essentially looking at, if you see whether people are choosing more decentralized mechanisms or centralized mechanisms. Yeah, so the teacher principle perhaps is more decentralized in that sense. So that's about 50-60% of the answers are there. Okay, excellent. So we've had a fantastic round. They've told me we have run out of time. There were a few more rapid fire questions, but we will reserve that for the later. And I just want to end this with some closing thoughts. I mean, I've made tons of notes here. Teacher directed, peer interactions was something that I picked up. Human in the loop, that was something that came out. A framework for fairness and unbiased way, pedagogy rules, etc. So number of different points have come out. These are some closing thoughts. Like I initially said, the coin systems, I think it's important to look at trustworthy by design across the 6 layers, all the 6 layers. Harm management, for example, as an ecosystem governance. So harm to students, harm to institutions, and harms to the society. So think at multiple levels and how we can prevent them. Safety is co-agency. Yeah? So this is a very important aspect, especially for digitally unsophisticated learners. How do we give that agency? This is exactly the human in the loop. Yeah? So routed to a teacher and so on. That becomes important. And the last point, the scale inclusion governance as an infrastructure layer. Just 2 days back, we had a conference here called the Bodhan AI Conclave, where, exactly in Bharat Mandapam, where the Government of India's Center of Excellence for AI in Education was announced. IIT Madras is leading that effort, and the effort is to create such kind of DPIs for education. So that's the thing. Thank you. A warm round of applause to there's one.
Yes, we have a small memento from India AI.
Oh, thank you. Thank you. Here.
Like this. This one.
No, should I hold it?
This one.
I think they want the logo.
Logo, right? Thank you.
Thank you.
Oh. How are you? We are not done yet. Hold on, Shavita. Shavita. We're not done yet. There's one more round of applause. From IIT.
Oh, here we go. You're passing the memento. From us at IIT Madras. I will do it. I think that's it. Ravi, you want to do the final one? Yes. Thank you. So this is thank you so much.
global priority, not just the national priority. Today, we are going to witness magnificent stride by seeding seeds of global collaboration between India and Israel for jointly pushing the global AI agriculture agenda. We from IIT Roper are looking forward to global collaboration for technology-assistive agriculture. We at IIT Roper, a new generation of Indian Institute of Technology from the state of Punjab that is regarded as an agriculture basket of the country. Thanks to Ms. Maya from Embassy of Israel to India to cultivate this global collaboration that started from an Indian delegation to Israel to this day, where we are having a joint dialogue for global collaboration to bring artificial intelligence impact on agriculture. We at IIT Roper are dwelling into AI revolution for agriculture with our national initiative Annam AI Foundation, an artificial intelligence center of excellence for agriculture under Ministry of Education, a nodal center of excellence of the entire country for agriculture. Ladies and gentlemen, as we kickstart our session on Agri-AI, Advancing Responsible Artificial Intelligence for Agriculture, please join me in welcoming our inaugural panel speakers, our Chief Patron, Director, IIT Roper, Professor Rajiv Ahuja. I'll request you to please be standing here. We will also invite everyone for a group photograph. I take pleasure in welcoming Professor Victor, Research Scientist, Institute of Agriculture and Biosystem Engineering from Israel. So join me in welcoming Dr. Gal, Head of Research and Policy Department, Israeli Public Employment Services. Dr. Gal will request you to be here with us. Please join me in welcoming Professor Dove, Founder and Director of Zevi Mater Institute. Please, Dr. Dove. And ladies and gentlemen, join me in welcoming His Excellency Reuven Ezar, Ambassador of Israel to India. We'll also take a moment of inviting our other speakers, Ms. Nimisisa, Mr. Mayuresh, Ms. Urmi, Ms. Maya, and Dr. Mukesh Keswal for a group photograph. Should we come? So all the speakers are here with us.
Some you can come there.
It's our almost pleasure to have the amazing lineup. We look forward to have thought-provoking inputs on global AI for agriculture collaboration, the new dawn for AI impacts jointly together by India and Israel. To start with our panel, we are awaiting for Professor Victor, but I think so we can start with the panel. So, to kickstart the session and for setting the right tone for this global collaboration between India and Israel for artificial intelligence in agriculture, I request our Chief Patron, Professor Rajiv Ahuja, to start with the vision behind bringing India and Israel together for agriculture.
I think we can start now. So thanks, Radhika, and thanks to His Excellency, you came here all the way. And it's really a great pleasure for IIT Roper be part of this collaboration and a part of this event actually. And if you, as Radhika already mentioned, that we are not the old generation IIT, we are a young generation IIT. And we believe more in advancement in technology, and we are well adapted to the new technologies. So, and although IIT Ropar is a IIT which is situated in Punjab, and as I say that Punjab was known to be a food bowl of India, and agri goes very well with IIT Ropar because being in a Punjab. And out of 23 IITs, I think I can assure you that we are only IIT which are working in very heavily in the area of agri-tech. So agri-tech is a part of the main curricula also in IIT Ropar. And keeping that in mind, we are the first IIT which is running a B.Tech program in digital agriculture. And we see that Israel is a very natural partner with IIT Ropar, because we have got very recently, last year we got a new center of excellence which is AI for agriculture. This is a 3 sectorial application where ministry has set up 3 different centers, one in one in digital health, one in agriculture, and one in smart cities. So we are holding the AI COE for agri-tech, and we are looking forward to work with all our knowledge partners, and especially the country which are far in the forefront of the technology, how they are adopting technology in the agri sector. Because India has more than 70% of population living in a countryside, and the main profession is agriculture. The food security is very important for all of us, especially in India. And we also want to help our farmer how they can grow, how we can increase their productivity, how AI can help them. For example, in weather forecasting or the soil testing or even animal health also. So there are many verticals which IIT Ropar is working, and also we are developing a big large language model which we call Agri-LLM. So where we can help our farmers. When they ask some questions, some queries, we can help them in a better way. So the AI Agri-LLM is also where we are developing at IIT Ropar. And whatever the solution, what we have developed in IIT Ropar, they are made in IIT Ropar, including the electronics. It's not like that we assemble the components. We make all electronics, and we are, for example, our weather station are installed all over the India right now. And our weather station has an accuracy of 99% given by IMD department in Pune. So we are setting up a weather station in UP, Punjab, Haryana, Andhra, J&K, so many states. So they can get accurate weather data, our farmers can, and they can also get the soil tested in a better way, so they can grow their crops in a different manner or very productive manner. So this is our aim, and we are in talking terms with the FPOs and farmers directly actually. So this gives us also a due kind of feedback where we are working directly with the farmers. And in Punjab, some of the farmers are very progressive, so they are adopting this technology. And of course, we are working with the Andhra also, and we are working in UP also. Being a bigger state, so we are putting all these weather station, at least one in one Gram Panchayat. And the cost is very effective and it's very scalable. We have put the cost almost around 15,000 Indian rupees only. So it's very cheap solution for farmers. And same thing, it can give not only the weather, but it also gives the information about your rain, radiation, wind speed, and the soil temperature, humidity of your soil in your field. So this gives you a multidimensional weather station with very high accuracy. And based on this data, we can make perfect or responsible AI models. And in the end, the data is data is oil for today, actually. Our minister was saying day before yesterday, because he was an oil minister, petroleum minister, he was saying, I didn't know that data will also become a petrol or oil. So data is the oil and the future, and India has the data, so we can make a very responsible and a predictable AI for our farmers so they can increase their productivity, and also the pest control and the crop damage, all this can be studied while sitting and getting this information in their apps. So this is the way IIT Ropar is growing, and we are very proud of that. We got this center, and we have got opportunity to work with Israel, and we are looking forward to work with you.
Thank you. Thank you so much, Professor Huja, for setting the right tone for this session, where what is there from our side, and we look forward to collaborate with Israel on the same side. So we move next to Dr. Gal for his input, listening to what is coming from an Indian side, from the Nodal Center of Excellence for Artificial Intelligence in Agriculture, how you see the potential opportunities of collaborating with the Indian counterparts for the joint AI impact together. All right. Professor Gal, I'll request, as our ambassador has some important assignments lined in a couple of minutes. So before we move to our fellow panelists, I would like, in fact, we all would like to have the thought-provoking session and the vision for India and Israel coming together from His Excellency, from Ambassador himself.
Hello, everybody. I'm really thrilled to be here at the AI Summit, and I want to thank the organizers, IIT Ropar and Maya Sherman from the embassy, as well as welcoming my colleagues from Israel. Thank you for making all the way to come here and speak with us. Imagine a day in which every farmer in India, every one of the millions and millions of farmers, will be able to have in his cell phone the entire knowledge that research has gathered in history and make it available for him to implement in his plot. Whether in a situation that all the weather information, all the knowledge gathered about soil analysis, all the knowledge gathered about the quality of the right seeds to put, all the knowledge guiding him when to plant, what to plant, when to fertilize, when to irrigate, how much to irrigate. The satellite imagery that would analyze the soil, the water in the soil, the humidity of the soil, will be available not just for the entire plot, for every plant in his plot. Imagine that all that would be available thanks to the huge amount of knowledge that has been gathered and that is accumulated by AI. Well, the news, ladies and gentlemen, is that this technology is already available. And we are going to use the platform that we have built with the government of India in the last 30 years to make this knowledge available to each and every farmer. We, as you know, have built together with a huge investment from the Indian government that has spent between $3 to $4 million in each one of the 34 centers of excellence that are spread all around India, with modern irrigation systems, modern nurseries that supply subsidized seedlings to the farmers, seedlings that have the qualities that are required in order to get better crops and to use less pesticides. This is all working today, and we are going to add a layer that we started actually experimenting this year in 9 plots in Punjab, Haryana, and Maharashtra. And these plots are being demonstrating the technology of an Israeli company called NDRIP. You might want to look it up, ndrip.com. This company has developed a system that actually not only does almost all of what I mentioned before, but also does it with a requirement of almost zero energy. And why is that? It's because NDRIP is using a very specific technology in which the irrigation chip doesn't need a lot of pressure in the water. And you can use actually gravity to irrigate a plot of 150 meters on 150 meters. And this system that costs no more than $2,000 and can be useful for a farmer for several years can gather with sensors the analysis of the ground and transmit it directly to an AI center that actually helps the farmer and tells him what is the situation of his soil, when to plant, when to harvest, when to fertilize. Everything is available now. NDRIP has already implemented, is applied in several fields around the country in private farms. I personally visited one of them about a month ago near Agra in Uttar Pradesh. And now we have finished establishing, as I said, 9 demonstration plots in the centers of excellence. We hope that after the Ministry of Agriculture analyzes the results of these plots, they will decide to adopt it nationwide. And once that happens, the implications for the average Indian farmer will be huge. So we are so happy that thanks to the trust that we have built with the Indian government, thanks to the cooperation we have been having with agricultural research institutes such as IIT Ropar, we are bringing this news to the agricultural sector in India, to the farmers of India, and I know that as much as we have succeeded so far in getting modern irrigation systems to millions and millions of farmers around the country, we are going to do the same with AI, thanks to technologies like NDRIP and many other technologies that together we will bring to this country. Thank you very much.
Thank you. Thank you so much for the vibrant words and the thought that you have shared with us. Of course, the success lies in joint collaboration and together, not just starting with the Agra, but of course, reaching to Punjab with IIT Ropar. Thank you. Thank you for your words. Now I jump back to Professor Gal for his perspective on how the way forward for India and Israel coming together to take it forward from here.
Well, I don't know if you know that in Israel there's a labor shortage right now. So when there's a labor shortage, what do? Actually, you have one option is to raise salaries for attract people. Another way is to find more workers. And we're trying to find workers. We can't find workers anywhere. And at the same time, there's an alternatives to implement automation and start working with new tools and the Gen AI and the LLM models and all of the models fits for the artificial intelligence right now allows us to make this technology available for everyone. For instance, if you know, the democratization of the technology allows us, for each one of us, to be a developer in that building applications. This allows us for everyone during agriculture, when you're in the field of agriculture and other businesses as well, to develop things by your own. And each one of us has this potential to become some kind of inventor. And this artificial intelligence, and that's one thing that we're doing in Israel, I think, is allows us to work with this new technology to fit together and to find the best way to coordinate, allows all of the people to be part of this process. And that's something we're trying to do in Israel, and I know you're trying to do that as well in India, to make this technology available for everyone, to use it more commonly. This allows us to make this quantum leap in working with being more efficient, being more productive, and so there's a lot of things, a lot of working with smart agriculture in Israel, a lot of practices, what to do with the crops and understanding, working with data. For each one of us, this technology has become available. So that's something I think it's one advantage of working together, do joint ventures, in order to allow more people to be part of this process. What we do, for instance, at the Israel Employment Services in Israel is like trying to find, to work on both sides of the aisle, working with employers, understanding, introducing a new technology, and at the same time introducing also skills for the labor market in order them to know how to use this technology. Sometimes it's very basic, and that's something we're trying to develop, and I think that's a lot of pros in this kind of interventions, and there's a lot for us to bring in, a lot of things for us to understand and to know, and I think working together allows us to implement that very efficiently.
Thank you so much, Professor Gal, for sharing these thoughts and, of course, collaborating together to understand the pain points from both the sides and how we can jointly work together for this. Now, for a different perspective, as we were having a pre-introduction chat with Professor Dove, so would like to have your thoughts on how the seeding of this collaboration can take forward in terms of modernizing agriculture.
Okay, thank you very much. I want to thank Maya and the Embassy of Israel and IIT Roper for hosting this. I want to actually talk about some governance issues that my institute is thinking about an emerging technology in this space. A lot of people, when they talk about AI and biotech, talk about automation, they talk about data, they talk about sensors, they talk about information. I want to talk about a novel area, again, where we are thinking about governance in this space. And really quickly, I'm totally switching track. So all of life on the planet follows the exact same rules for the most part. We're all made up of DNA. DNA is comprised of how many letters? Anyone know? 4. That's right. And DNA letters make up words that we call codons. Those codons translate into amino acids, which are the basis for our proteins. Each codon is 3 letters long. That means the dictionary of DNA words is, any mathematicians here? The dictionary of DNA words is 64 words. That's what we have, 64 words of DNA in the entirety of life on the planet, for the most part, with some exceptions. Interestingly enough, what that means, if there's only 20 amino acids that we have 64 words for 20 amino acids, which means that we have what we call a degenerate system. We have a lot of redundancy in the system. And what is emerging now is the technology facilitated by AI for refactoring the human genome, or for refactoring biotechnological crops. What does refactoring mean? That means that we can take a codon that is redundant, and we can add something, and we can change it. We can change it to allow not only optimization facilitated by artificial intelligence, but we can actually introduce novel aspects to proteins. We can introduce non-organic components to proteins, which creates huge opportunities in the area of biotechnology. Thinking about this, though, thinking about the governance issues in this space, there are a lot of really interesting issues that have to be tackled before we can promote this sort of technology. For example, you have to think about patenting. Who owns these emerging technologies? Who facilitates this? Who will implement this? We have to think about, to some degree, whether or not there are concerns with the development of Frankenstein-like crops that we don't, what we call unknowable unknowables. What will happen down the road when we start changing the fundamental aspects of genomes? We have to think about whether or not this qualifies as genetically modified organisms or not. Unfortunately, we also have to think about the weaponization of this technology, whether or not you can create, whether or not malicious actors can create novel sorts of crops that are effectively undetectable because our technologies don't allow for the detection of these sort of novel refactored genomes. Another concern is that the pace of artificial intelligence in allowing us to refactor these genomes sort of outpaces the governance that we currently have, and thinking about how to implement governance today that will be useful tomorrow when this emerging technology erupts. How do we think about those things as well? Of course, AI provides low barriers of entry, so whereas in the past you may need a large university laboratory to develop these refactored genomes, nowadays you can have biohackers in their garages developing these technologies. How do we govern this? How do we protect ourselves from malicious actors? How do we protect ourselves from negligent actors in this sort of space? Thinking about sort of the consolidation of farming, where we have optimized sort of biotechnological outputs, and those optimizations are owned by large corporations. What does that mean for the millions of farmers here in India and abroad? And of course, ultimately, who decides whether or not we move on with this? Who decides whether or not we pass on this technology? How do we decide how to implement these technologies? These are all questions for emerging technologies my institute is thinking about. These are things that we, both in Israel and in India, have to think about the implementation of artificial intelligence in the biotechnological sector. A lot of very interesting questions, very few good answers. So thank you very much for the time.
Thank you. Thank you so much for bringing this concept of ATGC, the 4 letters that play a very important role in making up the DNA that makes up the whole biome. Thank you. Thank you for your perspective. Now, I'll request, and before that, we welcome you, Professor Victor, a research scientist from Institute of Agriculture and Biosystem Engineering, to this particular session. And we would love to have your thoughts in terms of how you see AI for agriculture, specifically happening in India and Israel.
Thank you very much for inviting me and being here. I'm very happy, and thank you for being here. I'm a researcher, I'm a scientist, I'm an engineer in the Institute of Ag Engineering and Biosystems Engineering in Israel, working in AI in agriculture, and I want to bring here a probably completely different aspect than those that I have heard the last few hours that I've been in this summit. We do research in agriculture in order to solve the problem of food security. We need to provide food to billions of people, and this exponentially increases during the last years. And agriculture is the way that we have to feed all these people. And using the conventional methods of agriculture, usually they pollute the environment, and they are not sustainable. The new technologies that they are now used in agriculture, like precision agriculture and digital agriculture, which have been developed from the last years of the previous century, 1990s, 2000 and so forth, they keep using both technological systems in order to produce a lot of data, a lot of measurements to understand what is happening and make the agricultural production more efficient. And this has been a struggle of a lot of years of how to use all this information in order to make agriculture more efficient. The last 10 years, AI has come in. And suddenly, all this data that is gathered and measured around the world in different crops, in different countries, in different climates, they can all be combined together in order to get some knowledge or some incentives that were not so evident before. But are we there? Because we are there probably in some other disciplines, like when you ask your ChatGPT or Gemini about things to have some knowledge and some incentives, then they give you in different topics. And those are the topics that the AI models have been trained upon. Those topics are usually that all the data is available in digital form, and the models can be trained. But is this the case in agriculture? Probably not yet, at least. All this knowledge and all this data exists in agriculture, but we cannot really use it. We cannot make an agricultural advisor who is a robust and generalized advisor all over the world. It's different in India, different in Israel, different in Europe, different in South America. Now, but we can go and try to generalize this and build AI models, LLM models, large language models, in order to do that. But AI in agriculture is also in a much more basic place. We use we develop in agriculture systems like system for detecting weeds in the field, in order to spray just the points where the weeds are detected. We develop systems that they detect diseases and pests in a very early stages in order to treat them locally. We develop systems that they can see how the plants are developing. We develop systems that they link between the phenotype, how the plants look, and the genotype, how the genes are. And here I refer to what you are talking about, the genotypes. AI are today tools that they improve and they enable the genetic selection, not genetic engineering, but genetic selection of varieties that are more resilient to the climate change, more resilient to heat waves, more resilient to salts in the soil, and so forth. So AI tools in agriculture come in many different levels, from the level of being in the field and detecting and doing things, to the level of having the knowledge and address the whole management, the management strategy. But this is a little bit far from today, because the data that we have in agriculture is not shared as it is in other disciplines in the world. And also it's not in the standard format. Standardization is a very difficult and problem that has to be addressed in agriculture. But the AI, they have the possibility to solve these problems and get agriculture in a much better place. The adoption of AI in agriculture still has other barriers, like the legal barrier, the financial barrier has to be economical, and these are still challenges to be met.
Thank you so much. And you rightly said that in terms of adoption, there are a number of challenges and barriers that together we have to come forward. With this, we come to the end of the inaugural panel. I would request Professor Rajiv Ahuja for the final words on behalf of our Israel friends and from an Indian representation for his final remarks.
So it's already well said, actually, Radhika. And we are going to have a very active collaboration and to work together in a team, bit from Indian side and from Israel side. And I'm sure that when we will work together, and there are a lot of other opportunities will come up also. And then because he has said very many diverse things actually. So we have to think about that also, and which we were not thinking before. And it's good to have a people with a different mindset coming, and we are going to work together. And I'm sure that with the support of Israel government and with the Indian government support, and we are going to use AI for the best of our farmers. So we can make farmer most prosperous farmers in this India using AI. So this is our wish, and the farmer should be the main priority here. So thank you.
Thank you so much for the wonderful panel and the thought-provoking inputs that we have received from all the speakers. All right. So with this, we thank everyone for joining us. We move to the next panel, and for that, I'll request my colleague, Dr. Mukesh, to please be on the floor.
Thank you, Radhika, for moderating this panel wonderfully. And to all the speakers as well for joining us from Israel as well as from India. We also really, thanks to all the audience who were able to come here in the last panel of the day. While we have another one more largely from the investment community side, and when we talk about the agri-tech industry, it's very important to have the investment side as well, and from the corporate side. I would like to request my panelist over here now, where we will be having discussion around bridging nations through the AI, and also talking about scaling AI innovation for the public good. I would like to call first panelist or the moderator for this, Ms. Maya, a good friend from the Israel Embassy side. I also would like to call Ms. Nimisisa on the stage. To Ms. Urmi, please, if she could also join us. And Mr. Mayuris, a good friend from the Sea Fund side. Simran, can you help them? Simran will help you to put people's name there. So we'll be having a discussion around that, but before this, I also wanted to give some insight about IIT Roper in terms of the investment and the agri ecosystem that we are building. As of now, we host almost 250 plus startups where we have made investment of somewhere around 17 crore plus in the last 2.5 years. And very proud to say that this particular portfolio has raised almost 120 crore from the external community side, from the VC side. And we are also very proud to say that when we look out to the Annam, Awadh, and various ministries like Startup India and all, these all have been playing out a very powerful role in terms of enabling out the agri ecosystem. I will be handing over this to Maya from here, and I hope that we will have a very insightful conversation and a discussion around it. Thank you once again, and Maya, over to you.
So hello everyone, long day, but I think a lot of insights and quite exciting milestone for India with the summit. And very grateful, first of all, to have a representative from our government presenting a bit about the work. And generally very grateful for the work with IIT Europa over the last few months. It's been very intense, but I think a lot of very important milestones. I'm also quite excited about the panelists we have today. Again, dear colleagues and friends, but I think also bringing fascinating expertise across the ecosystem in India, from the VCC space, from the governance space, big tech. So we'll be very glad to hear your insight as we go forward. As we embark, I'll be glad perhaps a quick overview from your side, a bit on how you're, first of all, how are you perceiving this big event and how it's relevant for you? But if you can share a bit on some of the challenges that you're seeing about cross-border innovation today, and how do you think we should go forward, and if AI is relevant at all in this regard? Is that with you, Naresh?
So, IIT Roper team, thanks for having me. I'm trying to think when was the last time I was on a panel where we had as many women as we have in this panel. It's largely all male or a token women. So kudos to you. You could have very well had an all-women panel also. But we'll run with what you have. I was observing what you have up here. The transcription is at about 85-90%, but the translation is almost 95-100%. So kudos to what Bashini is doing, right? And we need more of such programs in India. Let me give you some introduction of what I do. I was the earlier lot that GE hired in the country to do data science all the way back in the early noughties, which obviously became machine learning and which is now AI to all of us. We've been making investments for almost 15 years. As a fund, almost 8 years. Deep tech is a focus area of focus for us. When we spoke to our investors in 2018 that we want to do deep tech, we were laughed out of the room. And for us, deep tech was semiconductor space, defense. Similar or investors who have an inclination to invest, when we go and say that we want to make areas in these investments in these areas, they're not blinking. They're still not laughing away, seeing money, but they're not blinking. What is the relevance of this this event? I think on two parts. One, we clearly need this. I think this is the third or fourth event.
First and the biggest.
Yeah, but fourth, right? There was one in the UK, France. Correct. I think it is about time that an emerging economy like India has to start playing or having a seat at the table. I'll tell you why. I think some data came out a few weeks back as to which countries are how well disposed towards AI. The West, there's a whole lot of fear. China, there's a whole lot of optimism. So is the case in the Far East. I think we are somewhere in the middle. This is a different beast for sure. But you can't be running away from a technology. It has never worked historically and it won't work this way also. So you have to have a positive predisposition and focus on what are the positives that it can give. One small example, I don't know how many of us had problems getting in, but it's criminal in this day and age where there is such loss of all our times and productivity, right? There are three things that are important for our economies to grow. There's capital, there's labor, and there's productivity. Till this current burst of productivity that the US has had, productivity has plateaued. But if we have aspirations to be a developed country in the next 25, 30 years, I think AI has to play a crucial role. What is working is obviously all these elements, and I'll pause there and I'll let the other panelists speak.
Thank you for having me. I'm Urmi. I work for a company called Salesforce. So we are majorly into agents, and this is something that we've invested in. And we're looking at deploying agents for public good and public use cases in healthcare, in finance, and incredibly sensitive areas as and when we look at it. So a big part of the responsibility that we have is deploying this responsibly at scale, so innovating but also having the right guardrails so that this is something that builds trust. And Maya, when you asked about some of the biggest challenges that we have when we look at deploying agents or AI, is institutional trust, is telling people that, can you trust this AI system? Is your data secure? Are they able to use this for longer? And I think that's one of the main conversations we have when we think about adoption, because for a company like ours, it's great to have a product, but you need people to understand the value of it. You need people to adopt it and use it, make it relevant in their daily lives. So how can they do that if they don't trust the system? So it's also not just educating people about the risks or the benefits or what is it that they can control, what AI can do, cannot do, what they should be mindful of, but also looking at the ecosystem around it that supports large-scale adoption of technology for a sustained period. So those are some of the things that we're working on, where we're trying to solve for. So not just the technology, but the human element of trust.
Hello, hi, I'm Nemesisa, and it's really an honor to be here. Thanks to IIT Roper and the Embassy of Israel to organize this very important discussion. When we talk about agriculture, in India, half of the population, half of the working population is actually engaged in agriculture. And only 1/5 of the GDP is being, agriculture is only contributing to the GDP. It's less than 15%. 65% of the farmers have got smartphones, and 80% of all fresh water which is used in India is used in agriculture. While if you think about it, at least 20% of all agricultural produce is damaged. So the case for AI in agriculture is so strong. And when we say today we have so many startups doing so many things, out of 200,000 startups in India, only 1,500 to 2,000 are actually working in agri-tech. So this discussion is very important. I have been part of this ecosystem since, I think, 2011. I am working for an organization called Hunch Ventures. It's a family office. We have deployed more than $100 million across sectors, industries, within India, outside India. One of the last investments that we made was in an agri-tech startup, which is doing a farm-to-fork model, while we are also looking at creating food parks across different states in India. And I'm here today to talk, like the work that I do with The Circle, which is an organization doing cross-border startup programs. I sit at the intersection of ecosystems, helping innovation find market, or actually supporting them to face market realities. And in AI, as much as we are talking today, there are a lot of market realities that has to be faced by the startups, by those who are creating innovation. Because if you think of something like agriculture, which is the bread and butter of people, so many people, to get them to use it at scale, there are many challenges, but if that happens, then the kind of output we will get, that would be unprecedented. So I think it's a very important discussion, and it's great that we are having it today.
Wonderful, thank you, three of you. Mukesh, such a wonderful presentation. Maybe you want to share a bit from your side. How do you see the biggest challenges on cross-border innovation?
So I think I'll take very less time on that. We had a wonderful insight from all the members as an opening remark. But largely when you talk about the agri, and we were having this conversation just before this, the biggest challenge is on the adoption. We are talking about a community which works, as a conventional mechanism. And even if there is 1% chance of failure, we are talking about going out the entire crop cycle as a waste over there. So it means that whatever technology you are building, be it a startup, be it a government tech, or be it a technocrat, that technology has to have 100% efficiency and has to be 100% accuracy. The moment you say 1% fails, we are talking about one particular crop cycle, and not only that, there's a very heavy reason that government is not going behind the GM crop, because the crop also have a huge impact on the humanity over there. And this is where you have to be very precise, both in terms of adoption and in terms of building out that technology, which is one of the biggest challenges that we find while working with the agri community there.
Fantastic. Thank you for this. Again, so many questions can come out of it. Now, Mrs. I'd be glad to start with you. I mean, with the hunch and the circle you've invested in so many programs and cross-border programs worldwide, what are the next countries that you feel will lead cross-border innovation in the next decade?
Sure, Maya. I think the future of AI will not happen via some specific countries, but it will be through clusters. So from where I see, there are three kinds of clusters. One is the governance setters, those who are defining the rules, which includes the US for, say, models, compute, the kind of investments that are happening over there, and the EU from the regulation standpoint. While the other cluster could be those countries where the use cases are being defined because of the scalable deployments, such as China, India, Brazil. And they say that if something succeeds in India in agriculture, it can succeed anywhere. And I think the third cluster is the high precision, high tech agriculture innovation, which is happening through research and technology being developed in, say, Israel, in Netherlands, in Australia. So I think these clusters are very important, and the future would be the corridors, such as the India-Israel corridor, the India-ASEAN corridor, which will prove very, very critical for defining how things grow and scale.
Fantastic. I think, it brings such an interesting input here that while many countries are trying to fight against each other and kind of create this AI supremacy, in the end we are seeing clusters being formed. Across different technologies, I think especially AI is a great example for this, with the Pax Silica, Israel and India are part of this, but it's true, I think that's exactly what's perhaps setting the next decade of future technologies going forward. Would it be full multilateralism or perhaps still the arms race? I think it's still a question, but wonderful insights. Mr. Mayarash, of course, CFund has been such an early believer in deep tech. I'll be glad to hear a bit more on your broader vision for deep tech investing. How do you see instruments like, again, Research, Development, and Innovation Fund shaping the next decade of technologies?
I think we've come to a very critical point, at least with what's happening in India. There'll be a fair amount of us who've probably studied in the US, have been beneficiaries of programs like DARPA, NSF. And for the longest time, we were talking with our policymakers, we need to have something similar to that. It's taken a long time coming, but we finally have a program. Our GDP is probably $2,000 or there. Sorry, our per capita income is thereabouts. But for a country at our scale of development, we have a $12.5 billion program that brings together what DARPA does, what NSF does, and what the Eurostar does in Europe. I think that is going to be absolutely crucial, because all basic research and elements of translation research, it has to be and has been historically governed. No investor like us, forget investors, even angel investors will not participate where the startup is at a lab stage and it can't even move to a product. So that is going to be absolutely crucial. The first and second order effects of this are there is going to be enormous amount of money. It's going to be relatively, for our size, a flood of money in the ecosystem. Now, a lot of this, like with most government programs, may be wasted, but we've seen historically that there have been platforms, there have been startups that have been built out. The Indian digital public goods is a great example. And there is absolute hope that the AI mission, the quantum mission, the DLI scheme, which we have for semiconductors, defense, that is absolutely going to work out well. What the government did smartly was a few years back, they figured out where are the top 3-4 areas where the country has the most forex outflow. And shouldn't be a surprise, oil, commodities was the first one, the second one was defense, the third one was electronic manufacturing. And they passed each one of this, had schemes for them. So for the longest time, investors wouldn't touch anything that was manufacturing related. But things have changed so dramatically, like you have the 800-pound gorilla in the VC ecosystem, which is Axel, talking about or putting out a thesis about smart manufacturing. Right? So whoever are the manufacturing or the real world physical intelligence kind of founders, I think these are great days. It's not going to change dramatically, but it's definitely better than not having any money. Commoditized manufacturing, there's nothing there. But if you're doing something along these lines, there's absolutely money. Coming to agriculture, the problems are well known, right? I mean, small land parcels, data is strewn all across. So much so that defense is an area most investors will not touch. But we are looking at a startup where the sucker we are getting is, oh, okay, it's dual use. There is assured income from defense. And okay, there's an agriculture use case, so maybe we can live with that. So that's where agriculture falls on the hierarchy of investments. The first set of agri startups have been these platforms, the farm to fork kind of place. But going and addressing the problems that a farmer faces, throwing earth observation, throwing satellite imagery, throwing data, and the ability to serve these products at the minimal price points that we have, that is still a problem that is still has to be cracked in India.
Wonderful insight. I think that it's true that in many ways, this kind of hierarchy of investments put agriculture aside, but in many ways I also feel that, again, this shift into dual-use technologies has enabled perhaps a new avenue for agri-tech startups as a whole. Even, I guess, from the Israeli perspective, we know we have dozens of centers of excellence in the country. They always worked on agriculture. Now we're trying to shift a bit more into agri-tech in them. So hopefully this is something we'll be able perhaps to, I guess, give a different lens or a different avenue for agri-tech startups to get the right investments, especially as, again, economy-wise, it's clearly needed and relevant. For me, now a bit to you. Again, I think you have different hats, of course, the wonderful work in Salesforce, but again, also I know the wonderful AI fellowship from Raisina, where you did such great work around climate AI, and I wanted to hear a bit more from you on how you see India positioning itself as a responsible AI leader, especially in agri-tech and public goods cases.
That's a great question. I think India has a few problems that it's identified very clearly or that it wants to solve for, or what their priorities are in this space. One is scale. The other is innovation, but inclusive innovation. And it's also striking a balance between regulation and innovation. So some of the ways in which India has been doing this is through, as we mentioned, creating high-quality data sets. AI Kosh is the program, I think, and what they're trying to do is create these data sets which will feed into more precise interventions from AI systems and will really help solutions, especially in critical sectors like healthcare and agriculture. So, and apart from that, leveraging DPI has also been a priority for India. And it's one of those, it's one of India's best exports to the world in terms of having this public-facing infrastructure that others can use and build on. And to use that in agriculture, to use that in public health or public good cases is one of India's biggest strengths. And we've seen this as becoming very fertile ground for companies and private sector and governments and civil society to really come together and build something together. So it's really providing that foundational architecture, foundational field for companies and other stakeholders to come and collaborate and to build on these principles, to build on accountability, transparency, and create a solution together. So I think it's that field that India is offering, that it wants to be innovative, but it also wants to have those guardrails. It doesn't want to fence itself away from the private sector. And we've also been able to develop a pilot, for example, with the government of Andhra Pradesh, which is looking at regenerative agriculture, again, because of the kind of focus that India has, that it wants to be collaborative. And I think that's something that the world can really learn from.
Fantastic. I think that, in the end, seeing the level of government investment and relevance in this sector, it's not it's not something that you're seeing all over the world. I think that India is definitely pioneering this discussion and narrative, so thank you for this. Nemasisa, back to you. Again, I think that cross-border innovation has become kind of your second name in a way, but, and again, there are some upcoming delegations coming again to Korea and Taiwan, and a lot of very exciting milestones ahead for Hunch Venture. I will be glad to hear from you, if you were to pitch in a way, what do you think makes India as, again, a perfect destination for global agri-AI startups today, for any other countries? And again, Israel is one, but how would you say that India is currently positioned?
Sure, thank you, Maya. I think we are in very exciting times. India can be the perfect test bed for all sorts of AI solutions. Particularly in agriculture and agri-tech, I think there is lots of opportunity. The kind of data that can be made available right now, I don't think it is there, but it can be made available. The kind of use cases we can have, things that so many farmers, multiple kind of crops, climate issues, inefficient supply chains, all sorts of use cases are there. So I think that is one place where a lot of testing can be done. Second is, I think Mayuresh already mentioned about the digital public infrastructure, and I think all the panelists have mentioned, which India has created, and the AI innovation is evolving as the infrastructure is evolving. So I think that's a great place to be, because when both are growing together, there is a whole opportunity of, again, testing and coming to real solutions which can be scaled fast. And the final thing, it's a very pilot-ready market. The corporates are interested. The government is ready to provide sandboxes. The startups want to work within India, outside India, whether it is, Bihar or Uttar Pradesh or Vietnam, Southeast Asia. The founders are very hungry to go and test and deploy and get new market opportunities. So I think it's a great time. And if you look at it in an overall ecosystem manner also, I think India is not just a market to enter right now. It's a market from where you can build and scale to the world.
I'm convinced. What wonderful words, Saeed. And I think that, if you look for a moment at the size of the Impact Summit and, the level of scholars coming from all over the world to India, I think it shows the level of rigor and scale that the Indian ecosystem is bringing today. Mayuresh, back to you. Clearly, again, a lot of work and great work done by C-Fund. You're managing over 250 million crores over sectors. But I'll be glad to hear a bit more from you. How do you differentiate AI and agri-AI from other frontier deep tech technologies, especially as you were mentioning the difficulties in investment? So I'll be glad to hear from you how you're perceiving it and what would be the right way to reach it from your angle.
See, we can't play the US game. We just don't have the domestic capital to throw at problems, right? We don't have the billions of dollars to go out and buy compute and do LLMs. Neither can we play the Chinese game, where they've finally passed out manufacturing with the AI. We've got to find our own way. We have to solve our India-specific problems. We are a voice-first nation, and we have many languages. So anything that is being done by somebody sitting in the US, I don't think Indian founders should be even trying to solve it in the same playbook. I'll give you an example. The old SaaS playbook, hitting a 1 million in ARR within 2-3 years was a monumental achievement. That has gone out of the window. You hear crazy stories, and these are on the consumer side. Startups hitting $100 million in 6 months. The best I've seen in India is somebody doing $500,000 ARR in 45 days. That doesn't compound to even 10 million in 5 years. So how do you play that game? As a fund, we are betting a lot on physical intelligence in the real world. Things will change dramatically here too, but not to the extent that we are seeing on the software side of things. There's still things to be played out in the next 5 to 10 years. And I think agriculture, if we solve all the problems that India has, I think that falls in the sweet spot of that. You can't run a startup having Silicon Valley salary level, cost levels with Indian paying power. If you can crack that puzzle, if you can start making products, especially on the agri side for Bharat, as we call it, beyond the metros, tier 1 cities, I think there's a huge, the market is huge, and you won't find this market anywhere else.
Wonderful. Thank you for this. Omi, last question for you. You mentioned the very interesting initiative and pilot with the government of Andhra Pradesh. I'll be glad generally to hear from you. How do you see, again, big tech companies such as Salesforce enabling this work with governments to be able to move, again, AI pilots into national level impact progress? Because the question is also about the scale.
That's the million-dollar question that we're all trying to solve for. But I think two things that we're trying to focus on, I think other companies who are working with governments at the pilot stage are trying to focus on, is co-creation. So sort of from the ideational stage itself to deployment, involving stakeholders at every step. So that is, for us, it could be the government of Andhra Pradesh, but it also involves other stakeholders like farmers groups, or SAGs or NGOs that are working in this space. So if we are able to conceptualize the idea with as many pitfalls, as many difficulties from the inception stage, it sort of becomes embedded by design in the solution rather than something that surprises us towards the end. It's easier said than done, but this is the approach that works and is something that we're striving to achieve. The other is also taking the ecosystem along with you. So having an ecosystem approach. What I mean by that is focusing on skilling and capacity building so that people are able to understand the benefits of the technology that they are going to use and deploy. That is the only way that you see sustained adoption. That is the only way that you see an ecosystem growing with you when you're trying to encourage a solution. So it's sort of taking everyone with you when you're developing and also taking everyone's ideas with you, co-creating. These are two of the pathways that I think a lot of us are exploring.
Fantastic, thank you. I absolutely agree. I mean, co-creation is key. And I think, the wonderful work that Salesforce has done, I think definitely is making this kind of change, I feel, in the ecosystem. Now, as we are nearing to an end, I'd be glad for 30 seconds for you. We've had great insights on the ecosystem, how VCs are enabling the ecosystem, how we're able to push the government, investment, VCs. In the end, farmers are the core. How do you see the future? And more interestingly, how do we make sure that farmers are not left behind when we're pushing these innovations? But again, crisp 30-second interventions. Mukesh, to this one, I'll also be glad to hear from you.
I think, rightly said by all the members, we are at an inflection point where we have to talk about farmers. We have to talk about the yield. We have to talk about the funds that can be deployed by the government, and also so that the community could grow together for the betterment of the impact and betterment of the society.
I'll just say one line. I think farmers, as the community is today across the country, they need trust. And they need to trust the technology, they need to trust the people who are creating the technology, and for that, they need two things. One, it is introduced to them by people they already know, intermediaries, and B, they are educated. And once they are educated, the support is also given to them once they have got a solution, and they are facing challenges that they don't know how to solve. So if those things are done, I think it will be a great boost.
I think we've spoken about co-creation and capacity building, but one element that I would introduce is also working on the explainability aspect of the models. So the farmer or whoever the stakeholder is should know where AI has come into the decision making and what is the process that has led to that decision. It is an ongoing endeavor with most companies trying to figure out the mechanisms to do this, but that should always be the endeavor.
I think I'll echo what your ambassador said. Everybody has the tech in their pocket. The pipe has been laid. India has the lowest cost per GB in the world. It's incumbent on all of us to make sure the intelligence is provided to the farmer at the price point he can afford.
Fantastic. Big rounds of applause for our wonderful panelists. Thank you so much. No, it's been a long day. I don't know if you have time for questions. Do we have? I think we don't have. So you still try to catch us afterwards. Thank you so much for the panelists and IIT Europa again. Wonderful to have been working on it. Thank you.
Thank you, Maya, for wonderfully moderating the session. Before we conclude with this session, we have a special gratitude towards speaker, and we want to express this with our felicitation from our side. Maya, I would like you to please step forward for felicitating our Chief Patron, Professor Rajiv Ahuja, for steering the session. Please, sir.
It's been a very long day, man.
Thank you. Now I request Professor Rajiv Ahuja and Maya to be please in front to felicitate Professor Gaul for wonderful insights from your side. You can come on. A special gratitude to Professor Dove. A huge round of applause. Now we want to felicitate the wonderful panel. Maya yourself has moderated it, from technology to investments. So I'll request Professor Ahuja to felicitate Maya for wonderful moderating the session. Ms. Nemesis, please. Ms. Urmi. And not the least, man of the panel, Mahiresh. So with this, we conclude our panel, and I request every one of you to please jump in here for a group photograph. Especially I'm requesting IIT Europa team and our friends from Israel to be here, so we have a group photograph together. I request our speakers to please take a seat, and we'll stand around them to be fit in one single frame. I'll request everyone to be please here, so we'll fit in a group photograph. I'll request everyone to be there with us.
Big hands to Isha and Ankit. It's not the easiest
आगे आ जाओ.
We'll take a couple of seconds. We have Professor Victor with us. So Professor Ahuja, I'll request you. Sthiti? There he is. Thank you so much.
This is for the
नहीं वो दे दिया उनको. But we had photograph.
Simran, photo?
Photograph ले लो उनसे.